Clerk will call the roll. Here.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Higgins, Commissioner Precinct 3.
Here.
Jeannie Hoop, Commissioner Precinct 4.
Here.
Thank you. Our invocation today will be delivered by Chris Agerfor, our own IT director. After the invocation, please remain standing for the pledges.
Good morning, George, commissioners.
Good morning, Chris.
Yes, sir. Let's bow our heads to the Lord this morning. Our Father in heaven, we thank you this morning for your goodness. I want to thank you this morning for your love. I want to thank you this morning, Father, because you made it possible for us to meet. I want to thank you, God, for all those that you brought out this morning for safe driving. Thank you, God, that you gave us breath this morning. You are a marvelous God, and may your name this morning be elevated. May your name be lifted up to the highest. I pray this morning, Father, that you will give wisdom and guidance to our leadership, to our judge and commissioners, and to all the speakers that will deliberate the business of governance, the business of leading your people. Father, that you speak through each of them. And Lord, that the decisions that will be reached this morning will be those that go to edify and lift up the citizens and residents of Tarrant County. Thank you, Father, because you're a living God, and I know that as we speak this moment, you are hearing us.
Yes.
May your name be glorified for that which will be achieved this morning. I pray this morning, Father, for the men and women of our law enforcement, for our troops who are keeping the peace in very difficult hotspots all around the world and in difficult places where they keep the peace within our borders. It is by your name, it is by your power, Lord, that they do what they do. And I ask this morning that you'll build a hedge of protection around each of them. Father, that they will do their duty and come back to their families. For that, I want to thank you. Because I know you're a good God. I know you'll do it. Thank you this morning, Father, for the struggles that our country is going through. Father, because I know that you'll lead us through. I know, Father, that our country sits right in your bosom this morning. And I ask that you be our protector. And as we continue the battle against this pandemic, this wicked disease that has taken many lives, I ask, Lord, that you give wisdom to our leaders in the decisions they make. Father, that when all is said and done, glory will be given unto your name for that which has been achieved. And for those that are mourning this morning, the lost ones, be the God of peace that I know you are. Father, guide those families, and even the family of IT, for our own loss. Father, be the God of peace. Thank you, Heavenly Father, this morning for those that will be celebrated, the employees of Tarrant County, for the beautiful work they do, for the hard work they do, God, for the years that they have given serving as public servants. May glory be given unto your name. And as we pray for this assembly this morning, Father, we declare it whole as we pray these things in the name of your Son, Jesus Christ. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible. Thank you, Chris.
Good morning.
Good morning.
So, members of the court, we have several announcements now as it relates to the agenda. Let's first go to the county administrator section, item A9. This concerns a bad debt write-off at the medical examiner's office. We're going to hold that particular item for 1 week. Also, under the administrator's section, item A13. This is a grant award to the HIV Administrative Agency. We're going to, for HOPWA, we're going to hold that for 1 week also. We had it mislabeled on the agenda, and we'll bring that back for your action next week. We do have several items that are on consent that we do have audience participation forms on. And the first one is under the auditor's section. This is item B2. Is it only B1? Okay, then B1 is not a consent item, then we'll move forward. We're just finding this out to this morning early. So also, members of the court, I'll get to it real quick. Under public health, item 8I1, we're going to hold that for 1 week. And then we do have one consent item that we do have a public speaker request for, and that is under the Sheriff's Department. It is item K4. It's the Livestock and Stray Enforcement Program lease agreement with the Water District. And then just a few more items. Today we do have a work session which we will take up after closed session. Also want to make you aware that next week we're going to be bringing in a briefing item as it relates to the JPS bond program. This is something that you all have requested. It's going to take between 20 and 25 minutes of our time next week. We did have a meeting Friday and with JPS, and so we want to report that back to the court next week. Thank you, Your Honor.
Thank you. Court members, you have before you the minutes of our regular meeting of September the 7th.
Move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Fickus. Commissioner Johnson?
Yes.
Motion passes unanimously. We have a resolution today for National Suicide Awareness Month, and I believe Faye Ballou and David Johnson are here. Why don't y'all come on down? I'll read this into the record and then come down there. Whereas we recognize the continuing and existing problem of suicide among U.S. adults, particularly among veterans, and the need for ongoing efforts to improve methods of suicide risk mitigation. And whereas the suicide rate among Texas veterans is significantly higher than the national general population rate, and whereas firearms account for 72.8% of veteran suicide deaths, higher than the Texas general population and 20 percentage points higher than the national general population. And whereas there is a groundswell of support for coordinated efforts at the local, regional, and national levels to implement a public health approach to end suicide. And whereas we are committed to understanding veteran suicide and applying epidemiological findings to inform veterans suicide prevention, while also proactively implementing outreach programs and interventions to end suicide. And whereas September is recognized as National Suicide Prevention Awareness Month, to raise awareness on how to protect yourself and your loved ones from this complex and tragic health issue. Now therefore be it resolved that we, the Commissioners Court of Tarrant County, in official recognition of this nationwide crisis, do hereby recognize the month of September 2021 as National Suicide Awareness Month throughout this county. And further, we urge all people in Tarrant County to join their fellow citizens to support our veterans and rededicate themselves to the prevention of further loss of these heroes to this plague of suicide. In witness whereof, we have herein to set our hands and cause the seal of Tarrant County to be affixed this 14th day of September 2021, and I'll move its approval.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Wait a minute. Don't get ahead of yourself.
Judge, I'll be brief. Commissioners, thank you so much for this proclamation this morning. We accept this on behalf of the more than 500,000 veterans, men and women, who call North Texas home. The challenges they face are beyond what I could put into words. But for you to recognize the efforts of Mission United and the Texas Veterans Network means so much to us. It's such an affirmation of the work that we do with this very special population. So thank you on their behalf.
Thank you.
We are close to catching up. Today we are recognizing those folks who celebrated 25 plus years with the county for the months of March and April of 2021. So we have about one group left after this, and we will have caught up with the folks that we didn't get a chance to recognize during the time during COVID when we did not have our employee recognition. So again, this is one of my favorite times. The first person that we're going to recognize today is Judge Bonnie Suttereth. Bonnie, stand up. Bonnie, no. Bonnie started out as a district judge. A lot of times the attorneys, the judges will have started off in the DA's office, but she started out, got appointed, I guess, she started out as a district judge, got appointed to the Second Court of Appeals in 2015, later ran, and then in 2017 she was appointed chief. And we were talking this morning, has done a great job for us. We really appreciate. When I asked her about memorable moments, I talked with her over the weekend, and I think we were all, or at least I was glued to the TV on Saturday, watching and remembering the events of 9/11. There are things that happen that we will never forget where we were. And that was just this case. And so the memorable moment for her was one, the 9/11, and then also the tornado, when the tornado hit downtown. She said, I really like the way that the county takes care of its folks. And, I hear that time and time again. Judge, we appreciate the way you kind of take care of the courts, and especially our Second Court of Appeals. And so thank you very much for your 25 years of service. Yes. And that's, I moved her up just so that, because she said, I've got to go to court, I've got some stuff going on. We appreciate you taking time to come down here today.
I appreciate you. Thank you.
Thank you. Thank you. Okay, well, that was not supposed to be what was going to happen next, but it did. Next is Debbie Connor, Domestic Relations. I don't believe Debbie was going to be able to make it down here today. Debbie's mother-in-law passed away just recently, and so she was not going to be able to make it. She's in the domestic relations area, and I hope that you will congratulate her on 25 years of service to the county and be with her. Next is Mike Cromer, Cscd. There's Mike. Started out in Cscd as probation field officer, was promoted to unit supervisor, and is now, I believe, in the Southwest office. When I asked him about a memorable moment, he said, there was a time when I had a little bit of a health issue, and he said, I can't tell you how great the department was to kind of circle the wagons to help me through that process. Everybody was very helpful. Everybody was very understanding. When I asked him what he likes most, he said, I just absolutely love what I do. Everything's a little bit different. He said, it's a wonderful county and a department to work for. He said, I guess when you started out, you worked for Lockheed for a while, and then you worked for Texas Parole Department for a while. And he said, when I came to the county, I have loved every day. He said, I enjoy every day coming to work. And, you can't ask for much more than that. I mean, when it's not a job, but it's a passion. And for so many of the people that I talk with, and for so many of the employees that we have here in Tarrant County, I truly believe that it is a passion. And, they're not going to give up the pay for doing this. But I think that's a lot of times secondary because they just absolutely love so much what they do. Mike, thank you for your 25 years of service. Next is Eddie Graham with Facilities Management, 25 years. There's Eddie back there. He said, I started out in the Correction Center, not in the Correction Center, but working in the Correction Center. He said, I have worked in every building west of the courthouse. And now he's working in Tim Curry Building in the Justice Center. He said, the benefits, what he likes most is the benefits and the security of the job. And again, I believe that because everybody in the county watches and works as efficiently and effectively with the tax dollars that we're given, that we have been able to weather the storms, whatever they may be, as we've gone along through the years. And that doesn't just happen. It happens because of everybody in this room and folks like Eddie. He said, I've been around here, obviously, for 25 years, and he said, I've seen a lot of friends that have retired, and he said, one of these days, I'm going to join many of those old friends in that retirement. Eddie, we appreciate very much the 25 years you've given to Tarrant County. Next is Jeannie Hoop, and I don't think she was going to be able to make it. She said, I'd love to be down here, but she said, I had scheduled a doctor's appointment 2 months ago and not going to be able to make it. But I still want to just tell you that I have enjoyed very much my time with Tarrant County. Next, okay, this thing is having fun with me today. Chan Jackson with Juvenile Services. There's Chan. Appreciate you being here this morning. Started off as a certified probation officer, then to an operations officer, and is now the assistant facility administrator. She said the memorable work is just the teamwork. The way everybody works together to try to do whatever they can do for the youth. And when I asked her what she likes most, it was the impact that she's had a chance to have on the youth. She said Tarrant County cares about its folks. And it's evident in the way we treat folks and the way we work with folks. She said, when she started, she said, I'd only planned to be here a few years. And then all of a sudden I blinked and 25 years had gone by. She said, again, I just absolutely love my job. Chan, we thank you so much for the 25 years of service you've given to Tarrant County. Thank you. Next is Bobby Jackson. Now, Bobby, you know, she works for Wilder, and so that's an adventure. That's an adventure. No, she actually had a few good things to say about you, Tom. So it was just, and I tried to, you know, I said to her, now, you know, I know he's probably paid you to say these things, but that's all right. No, she started in the DA's office in the hot check area and spent about 3 years there, then transferred over to the district clerk's office, worked in the passport area when it started, and she's now the assistant manager in the family law section. Memorable moment was when the tornado hit downtown. She said, you know, I was really kind of before cell phones, and she said it took me 2.5 hours to get home that night. When I asked her what she liked most, she said, through this work, she has developed lifelong friends, and that's something that's meant a lot. The benefits have meant a lot to her. When I asked her, you know, if there was anything else, she said, you know, I never really thought about how long I would stay here, but the time has just zipped right on by. And she said, I have to thank Mr. Wilder and tell him how much I appreciate the opportunities he's given me to advance in your department. And that's right, she earned it. And we can't thank you enough, Bobby, for the 25 years you've given to Tarrant County. Thank you. Next is Mike Kellerman. I don't believe Mike is going to be able to make it today. He has been out of town, and actually I think is still out of town, but he's been with Cscd for 25 years. When he gets back, please thank him for his time served, for the service that he's given to Cscd and to Tarrant County. You got to be careful of the words you use around here, especially depending on what department they're in. Next is Lisa Kissel. Well, and she also was not going to be able to be in court today. What she's loved about the county was, she said, the way that the flexibility that the folks have been flexible. Again, we're a family, and we understand the importance of the other family in working with folks. So when you see Lisa, please thank her for the 25 years of service that she's given in juvenile services. Next is Bernice Mack, Juvenile Services. There's Bernice. She started at JP5 with Judge Valdez, and then after a couple of years moved over to the Juvenile Services area, probation officer aide. After graduating from college, she became a probation officer, then a supervisor, and now she's a deputy assistant director. so many memorable moments. She said all of the years have been great. She said, I've really, really loved my job. She said the department has really given her a home. She loves the people that she's had a chance to work with. She said the time has gone by quickly. She's so thankful that as a young person, she made the right decision to come to work for Tarrant County. She said her job is a calling and that she loves that. She said, I'm very thankful for the sacrifice that her parents made so that she could become the young lady, the woman that she is, and the work that she's been able to do. And she thanks them very, very much for that. Bernice, we thank you for the 25 years of service you've given to Tarrant County. Thank you very much. Next is, well, it's Brian Taylor, but everybody calls him Taylor. There's Taylor, CSCD, 25 years, started as a probation officer. He said, I've been all over the department. I was in Mansfield when they had the boot camp out there. I've been a part of the sex offender unit, worked for 3 different judges, and now is working for Judge Cook in the County Criminal Court number 1. He said in the memorable moments, he said, I have so many little stories, but also a lot of success stories and a lot of stories that you just laugh so hard that you cry. When I asked him what he liked most, it was, again, the family atmosphere, watching folks that he works with as their families grew up. And, you know, after you spent 25 years or more, you have seen a lot of the folks you've watched, not only as you've raised your family, but also as others have raised their families. He said, I just love having an opportunity to work and to help people out. And he said, now, you know, I'm having a chance to work and to help kind of maybe guide the new folks that are coming into the department. Taylor, thank you so much for your 25 years of service to Tarrant County. Next is Willie Albarra. Where's Willie? There he is. Started out in the records department, was in the district or in the delinquent tax area for a while, then to District Civil Court 67th, opened the passport office. Helped with that, was then became one of the third floor supervisors in the criminal courts area, I believe, and then on the third, and then in the family law area. Then became assistant manager for the family law area, and now is assistant manager for the civil. When I asked him about memorable moments, he said, you know, over the years we've gone from all paper to all technology. Also COVID, this is something that I don't believe any of us are going to forget. And, you know, that's, it is what it is. When I asked him what he liked most, he said, it's the ability that I've had within this department to move up into advance. And again, Tom, I think that speaks a lot about the way you've run that department and the benefits and the opportunities you've given people. He said, I love the benefits. He said, he said, the county offers benefits and offers salaries that allow someone to raise a family. And he said, that's what it's meant to me. He said, I've been all over the district clerk's office. He said, I have 2 daughters. And GK, he wanted me to be sure and to mention this. He said he is the 2-time county golf tournament winner.
Did he say when he was going to retire?
No, he said, you know, he was going to stay as long as he could just so he could keep drumming you. Willie, thank you so much. Next is Thomas Davila, IT customer support. There he is. Started out as a computer operator on the second shift, then to office automation as a PC installer. Then he did desktop support out at Kimbo Road, and now he's basically supporting the Resource Connection, helping those folks out there. He said memorable moments was how much the county has changed over the years with IT. When I asked him what he liked most, he said it was the people, it was the opportunity to work with everyone, it was the benefits. He said, I love to play golf. I don't think, has he beat you too? He is at least shaking his head like he might not have.
If we had a courtroom full of people that have beaten me,
We'd
the
have
fire
to-
marshal would have a real problem.
We'd have to go over to the family law in the conference center over there. I understand that. 2 grown daughters, a couple of grandsons. When I asked him, kind of what's happened, he says he's going to always planned on being with the county until retirement because he looked and it was a good place to be for retirement. His grandsons are now 10 and 6. He said, this is an interesting thing. He says, I just try to stay under the radar. He said, as long as I make my customers happy, which are the people at the Resource Connection, he said, I feel like I've done my job and that's what I'm here to do. And I'll just tell you, Thomas, we appreciate very much the 30 years of service that you've given to Tarrant County. Thank you very much. Now, next is John Pettigon, but I don't believe he was going to be able to make it today. Again, they're kind of going through those quick trials, and he said, John mentioned that he was in the middle of a trial and would not be able to attend. So would you see John, thank him for his 30 years of service. He is in County Criminal Court number 2. Okay, next is Jim Skiffington, Skiff. And is Skiff here? Wasn't sure he was going to be able to make it. But again, another 30 years service. He is working over at the security door in the Civil Courts building. So if you see him today, thank him for his 30 years of service to the county. Next is Nancy Hawkins. Nancy's here. Now, I want to say she has 30 years of service, but she really has 40 years of service. She worked for about 5 years as a contract court reporter before we finally got her on to full time. And we were both commenting on the fact that she kind of wishes she'd had that 5 years of extra 5 years of retirement. But 35 is pretty good. She's again started off as part-time and then went full-time after about 6 years. Started out in County Criminal Court number 8, serving as the court reporter. She's she trained Judge Coffey and is now training Judge Vanover. Her daughter, well, let me see here. When I asked her what she liked most, she said, I enjoy working for the county. Became a mom while she was working for the county, has watched everybody grow up, watched her daughter grow up, worked with some really great people. Her daughter graduated from college and lives in Boston. And Nancy lost her husband last year. And she said that without the support of the office, she wasn't real sure how she'd have made it. She said her husband said, you don't quit work. You stay working.
He said it too.
And she did that, and she says it helped me get through it. She's retiring in January. And she said, again, her daughter lives out of state. And she she's going to have an opportunity to visit up there with them Yankees up in Massachusetts, up in Boston. And she's got a friend up there, so I kind of feel like she's going to be traveling back and forth. She said, I have had some absolutely great memories over the years. It's been a great job. And Nancy, I can't thank you enough for spending 40 years with this county. Next is Andrea Zinton. I know. It's, we'll just keep trying.
We've been doing this a long time.
Just saying.
Now, I believe it's 38 years, really.
37, 38. It's been a while.
Started out in child support area, worked with the district clerk for a while, and now she's basically accounting manager over the whole department. She spent a couple of years in personnel, and her father had passed away during that time, and she said, I cannot begin to thank the people in HR. Tina will come wandering in here in a little bit, but
She was there.
Robin, Tina, those folks really surrounded her and helped her through that time. She said, I absolutely love my job. I love the coworkers. They're such a close-knit group, and they really do take care of everyone. She said, I owe an awful lot to Tom and the opportunities he's given me. She said, I tell everybody how great the county is to work for. She has 3 grandbabies, 14, 3 years, and 5 months. She's retiring in June. Oh, you hadn't told him yet.
He's not listening.
He's not. Well, he's been known not to do that before. I'm just going to tell you that. But, Andrea, we can't thank you enough
Thank you.
for the years that you've given to Taylor County. Now, Jacqueline Sargent wasn't going to be able to make it. 40 years of service. She's in JP number 8. And please, if you see her, have an opportunity, thank her for the 40 years of service that she's given to Tarrant County. This really is the character of Tarrant County here. These are the folks who help us build a culture that we enjoy, and I think the reputation that we have all over this state. As people, you are sources that when it comes to seeking out guidance on how to do things or what to do next, they call Tarrant County. And they call them because we have people like y'all who have been here and who try to do the best job they can every day when they come to work. And truly, truly treat everybody as a valuable customer with the services that you provide. We can't thank you enough for the work that you do, but more importantly, for the way you do the work that you do. So thank all of y'all. We have some refreshments back in 504C for you. I wish we could do more. We really, really, really appreciate you. Thank you very much. And I move that we receive and file the employee recognition.
Second.
We have a motion to second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. I apologize. I should have asked for y'all to you had anything, because I know we're going to close. At this point in time, commissioners, do y'all have any other announcements that you'd like to make?
Yes, sir.
Excuse me.
Yes, Your Honor. This past Friday morning, Tarrant County and Tarrant County IT Department lost an employee and a friend. And we grieve with the family of Vanessa Ortega. And we grieve with her colleagues in Tarrant County IT. Vanessa was a dedicated employee of IT record management services. She started her career with elections as a temp, then moved to records management as a temp, then to full-time in 2008. She climbed the ranks and was promoted to imaging supervisor in 2013. She truly cared about her employees and treated them as family. Her friendly smile and contagious laugh were unforgettable. She was truly dedicated to her family, especially her nieces and nephews. She became an instant friend to anyone she met. Her love for cheeseburgers was unsurpassed. She had an amazing love for God and for her church. Her employees stated that they did not lose a boss, they lost a family member. She will truly be missed. Her mother, Melinda Ortega, works in Precinct 4.
She does.
I ask that we close court today in memory of Vanessa Ortega, and we send our thoughts and prayers to her family.
Judge, at our maintenance center, our maintenance business manager, Amanda Key, lost her husband, Stephen Key, about 10 days ago, and the funeral was on Friday. And Stephen had ALS, and those that know anything about that disease, it's a terrible, terrible disease to contact. And Amanda and her family, let's all keep them in our prayers. They have 2 sons, and she's a wonderful employee for us, and he was an integral part of our overall family there at the maintenance center. Stephen was. So, if we could close also in Stephen Key's memory. Thank you.
Thank you. Any other announcements this time? The court members, you have before you the consent agenda.
Move approval.
Second.
We have a motion and a second to approve the consent agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Mr. Manius.
Thank you, Your Honor. Members of the court, if we could go to the administrator section, we're going to take item number 1 first. We're requesting that the Commissioners Court approve an order which approves the Tarrant County government's tax rate for tax year 2021 as follows. Maintenance and operations, .213553 per $100 valuation. Interest and sinking, .015447 per $100 valuation, for a total tax rate of .229 per $100 valuation. The motion that will, if the court approves this, the motion should read that the Tarrant County property tax rate be adopted at a tax rate of .229 per $100 valuation, which is below the no new revenue rate. And for the court's information, this is a reduction of the current year's tax rate. It's a little over 2% reduction.
Move for approval.
Second.
We have a motion and a second. Any discussion? We have a couple of audience participations that I will call on at this time. First is Emmanuel Orgido. Come forward, please. Go ahead and repeat your name, and then you have 3 minutes to make any comments you'd like to make. Thank you, sir.
Judge Whitney, thank you for giving me the opportunity. My name is Emmanuel Ogidon, Ogidan. I happen to I've been a resident of Tarrant County since my existence in the United States. This has been my home. This has been the home that I have all my kids, 3 of them in all, 20-year-old, a 17-year-old, and a 10-year-old. I have worked with the Texas Attorney General's office for 15 years, the Child Support Division. So it gave me great joy when I saw Tarrant County staff, majority of them coming from Csd, spending as much as 25 years, 30 years, 40 years. The county, of course, has always been a place of envy while I was with the Attorney General's office as a child support officer. But today, the reason why I chose to discuss this issue is because the issue of the tax. I see also that I give credence to the county also for the fact that they have reduced in most cases. But when you look at the aspect of the school districts that we have, we've seen increases. My own school district, I happen to be in White Settlement. My kids go to White Settlement ISD. While my house is considered to be in the school district of Fort Worth. Unfortunately, there were increases in those areas. And it's always been a thing that I ponder every time I see my tax, why I have to pay tax in 2 places, to 2 school districts, to which I had no choice but to do. I know the expenses of these school districts are majorly burdened by the tax that we pay, property taxes that we pay. And I was wondering if at any point in time in future, we can look at a uniform way in which we pay tax collectively as not with regard to the needs of the school district that raises this every now and then. I appreciate you giving me this opportunity to address you, and I thank you for the way you handle things in Tarrant County District. God bless you.
Now, it's on the agenda so I can talk to you.
Oh, okay.
You should not be paying taxes to 2 different school districts. So that's the first thing that you said that concerns me. With regards to property tax, especially as it pertains to school,
yes,
I can get on a soapbox about what I think the state should be doing in that regard. I'll not make everybody suffer through that at this point in time. But I would encourage you, if you've got both the Fort Worth ISD
yes,
and White Settlement ISD on your tax statement,
yes,
either your home is sitting right on the line and it's split, there's not a way you should be paying taxes to both of those ISDs. So I would suggest,
Send him to me first.
if you'll talk with him,
Thank you.
Mr.
I
Manius,
appreciate
I'd like to see that. You don't happen to have that text statement with you, do you?
that. Unfortunately, not right here. But everything is online, so we can actually pull it up.
I'll bet you they can, if you'll give them an address, I'll bet you they can figure out and look at your tax statement.
I believe so.
Thank you so much for being here today. Thank you for your service to with the Attorney General's office.
Thank you, Judge Whitley. I appreciate you.
You bet. Next is Thomas Tolankoski. One of these days I may get that right.
Judge Whitley, Commissioners.
Could you stop a minute?
Sure.
Which one of his three?
This is the one where it says reports by the administrator. He changed that to say he wanted to speak about this particular item, the tax rate.
Okay, thank you.
Judge Whitley, Commissioners, I want to remind the court that under Texas State Statute 551.007, that in addition to the county judge, any and all commissioners can comment or ask questions of the speaker.
That's true, sir.
Thank you. Hopefully someone can share that at TRWD and TRBA specifically, because they do not do that. I wanted to talk about the tax rate and the opportunity to cut the tax rate even more than you already did. I think it's a token. Specifically, any single line item, a single dollar that is currently budgeted in the next fiscal year connected to TRWD or TRBA should be suspended. And my specific suggestion is the TRBA is scheduled to have a board meeting next week, the 23rd. The county's commissioners court provides 1 or 2 members and staff to that board. Currently, the TRBA board president is sitting 6 feet to my right. Unlike the county that you describe as running their organization efficiently and effectively and being good stewards of tax dollars, that is not the case there. And despite what your belief is and what you explained to me last week, the two entities are not separate entities. That's not how they behave. That's not how they perform. For example, Mr. Manius, as the president of the board, and all the board members have no line authority over the executive director. If they wanted to fire him, they could not. According to TRWD, Dan Boomin, the general manager of TRWD, has exclusive ability to terminate that position. There are a number of employees on the payroll at TRBA that are also paid by TRWD and have supervisors at TRWD. It gets worse. The CFO of both boards is the same human being. Her husband is the bond attorney that manages up to $100 million in bonds. I haven't checked yet to see how many of those are county affiliated or how much money the county has given them over the years. But until we get to the bottom of the waste, graft, corruption, nepotism, and inappropriate relationships there, we cannot be happy with the tax rate that is including money that's dedicated to this organization. I mean, we have the opportunity to have oversight there. That's what Mr. Manius and any other member of the Commissioner's Court is supposed to provide. If you check their minutes over the last 20 years, I can't find a single public comment. They meet sometimes every month. They meet 4 or 5 times a year when they change the schedule, but they are not accustomed to having public scrutiny or public speakers or anybody asking any questions. We're in the middle of a number of open public records requests. About 24 have been partially filled and more to come. And I can tell you that we have the documents and we have the evidence, and you'll hear a little bit more later.
Thank you, sir. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So, members of the court, we can now move to item number 2. This is a request to approve the Tarrant County Hospital District's tax rate for tax year 2021. The staff is recommending that the hospital tax rate be set as follows. Maintenance and operation is .223550 per $100 valuation. Interest and sinking is .000879 per $100 valuation for a total tax rate of .224429 per $100 valuation. Quick comment, the motion that we're asking to do is to approve the hospital district property tax rate be adopted at the rate of .224429 per $100 valuation, which is below the no new revenue rate.
So moved.
Second.
We have a motion and a second. Mr. Bucher, and I'm looking at one of your requests, and I see a whole bunch of stuff on here, one of which was the tax rate. I didn't call on you previously. Do you wish to speak to this particular tax rate?
Yes, sir.
Please come forward. Now, you've got a whole bunch of stuff on here. You've also got some other stuff later on, so I'm going to assume that on this one, I see tax rates, I see the audit that's coming up, and I'll call on you in a moment on that, as well as in a little bit on the vaccines. So this one I would just, I guess, kind of limit your discussion with regards to the tax rates.
My name is Robert Bucher, and I think we need to look at cutting that down a little bit more, especially with, the gerrymandering issues that we're having right now. Some of the people that I've spoke to on the south side, are having a lot of issues with, even though that's low, they're still having their properties go up higher. So some of the older people that I've talked to, they're having to sell their properties off, because for one reason or another, mainly because their kids have, moved off, and so they got too much house, and so they're just trying to want to scale down. Well, when they sell it off at 10 to 15% above the market value, because you have somebody that comes in there and slick talks them and says, hey, we'll sell it a little bit higher, they go to buy a house. They can't do it. So now they lose the aesthetics of the neighborhood. Now and most of the ones I've talked to end up having to go into a nursing home if they can't afford, for one reason or other, or they have to go into a retirement home. And so they lose the aesthetics of sitting out on their front porch and looking around and seeing, what they grew up in. So, right now I think we need to kind of hold off and look at, maybe going down a little bit more to try to offset it. Because, it hurts to see the things that you built for and you sell off to make a better way, for yourself, because, maybe you're on fixed income or not. I really think that we need to kind of hold off, and I'm not sure if this kind of voids the vote, and tell y'all after I speak. I'm not sure if that's right, but I would think that we need to look a little bit harder in there right now, especially, me going down in the Hemp Hill district and them not wanting to be sold off, which is why they have the no Sivende. So that's all I have to say on that one.
Okay, thank you very much, sir. Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of court, we can now go to item number 3. We are requesting that the Commissioners Court approve the Tarrant County Hospital District's fiscal year 2022 budget.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of court, if we could now go to item number 4. We are requesting that the Commissioners Court receive and file the Tarrant County Emergency Services District Number 1 fiscal year 2022 budget.
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And then finally, on the tax rates, on item number 5, we're requesting that the Commissioners Court approve the Tarrant County Emergency Services District Number 1 tax rate for tax year 2021 in the following manner. Maintenance and operation, .0819. Interest and sinking, they do not have any debt service, so there is no tax rate set for interest and sinking, for a total tax rate of .0819 per $100 valuation. We're seeking a motion this morning that that the court approve the property tax rate to be increased by the adoption of a tax rate of .0819 per $100 rate for the Tarrant County Emergency Services District, which is effectively a 1.7% increase in the tax rate. The ESD tax rate is above the no new tax revenue rate but below the voter approval rate.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of the court, as we go to item number 6, this is one you normally see in the front of our section, but we're now going to begin the discussions concerning the coronavirus, and we're going to ask Mr. Tenage to come up and make his presentation.
Good morning, Your Honor, and members of the court.
Morning, Benny.
Got weekly updates for you. So total number of cases in Tarrant County are now 328,000. So we're seeing a lot of numbers come in. I think last couple of days we had almost 2,700 cases reported each day. And then I think this morning we're adding another 1,700, somewhere in that range. And we've got some death counts also increased, 4,027 deaths reported in Tarrant County so far. The hospitalization trend, and I'll show that to you on the next chart, a little bit of a leveling off. We've held in that 1,100-1,200 range for about a week, but the ICUs are definitely burdened in the adult world. Pediatric hospitals, a whole other story. We hit a pandemic high of 48, I think, yesterday or day before yesterday, and I think we're back down to 41 kids in the hospital. But the issue here is all the hospital beds are full. There's no pediatric bed available in Tarrant County, and all the pediatric ICUs are full. So there's no ICU bed available in Tarrant County for kids. And as far as the ICUs go, the entire Metroplex doesn't have pediatric ICU. So if a child has a trauma, has a surgery, appendicitis, whatever, we've got trouble where to send these kids. So those are the type of things that the pandemic can put a strain on healthcare capacity that we all worry about, and it's here for us. Overall, though, a smidge lower than what we were just a few days ago. Tarrant County hospitals are 26.69% full. We're at 1,179 people confirmed with COVID in the hospital, and then the trauma service area E also just a little bit lower, 3,555 people in the hospital. That's 22.19%. So on the chart I'll show you there's a little bit of a flattening, but it's mixed news at best. So the case counts continue to increase, and the death counts are increasing as the two charts indicate. The R0 rate that we've been watching, the level of spread is above 1. So that means the virus is still actively accelerating in our community. So here's the chart I was talking about. So it's kind of hard to see with the two lines. The chart in the middle of the bottom row is the Tarrant County chart. But if you hover on the numbers on the live dashboard, you can see we've been just kind of hovering around that mark for about a week. I'm always trying to find some good news, and I think being overly optimistic, but let's see what happens. There's a couple other indicators that do support that. There's a flattening on the top of COVID-like illness. That's the chart on the right. And then there's a minor lowering overall in the trauma service area of the trend of hospitalization. So I'm kind of hopeful that Tarrant County will, as we lift all boats with a rising tide, I think we're going to come down with a lowering tide. That's my hope. But otherwise, the positivity rate, even though it's been effectively flat over the last 2-3 weeks, currently we're at a high of about 23%. And then our case rate continues to climb. We're at 495 cases per 100,000 population. So a mixed bag of indicators. It's not good news. It's still bad news, but I'm hoping we're leveling off. I mean, I'm just really hoping that the crystal ball works this time. National trends, similar story. The holiday kind of did some issues with the reporting, so you can see there was an undulation in the data. News coverage says we're flattening or starting to decline, but the chart shows a different story. There was a decline due to the holiday, and then there was a surge of reporting. So we'll see how it all sort of shakes out. The spread level on the chart on the right, As you can see, the entire country is now in the grip of this Delta variant. These colors had faded off, early in the spring after the vaccine came out, and it really sort of exploded in the southern United States with the Delta variant. And as you can see, the colors get deeper and they move around. Right now, it's very centered on Tennessee, Kentucky, West Virginia, Illinois, Ohio, all of these areas getting impacted. And then, northwestern part of the United States just took off right now. So we'll see how it all balances out over the next few weeks. Hospital trends. We're seeing a little bit of good news develop overall for Texas. There's a minor tapering of the hospitalization trend. So hopefully that's the start of the decline for those numbers for the state of Texas. We did match the peak of what happened in January. A lot of different reasons on why this may be happening, but overall, as you know, a lot of larger metro areas are in different policies related to masks. Some are doing it, some are not doing it. So I think we're seeing a mixed impact of that, but it's starting to have an impact on hospitalizations. Flu season is here, and I wanted to kind of highlight that. We're seeing an early rise in flu numbers, very strikingly different than what we saw last season. Last season, flu was almost non-existent. This time around, we've already been above our Tarrant County baseline for a few days here, and even the state of Texas touched the baseline levels and sort of trended off a little bit. It's still kind of early, but again, not good news developing, I can tell you that. If you look at the chart for the country, there's a few states that have already sort of started to turn darker shades with a lot of flu activity. And Texas is still considered a low spread, but we're heading higher from what I can see in the charts. So the message for both flu and COVID, get vaccinated. That's the answer. And then, of course, wear a mask, especially when diseases are surging right now. Just take extra precautions. Avoid unnecessary large crowds. Those messages work. They worked last year. When everybody does it together, it really has an impact. If we have, mixed approach to this, then the results are also mixed. So quick update on the vaccines. We have slow but steady improvements happening in our vaccinations. 2.4 million doses administered in the county. 970,000 people have been fully vaccinated with their completed series. That is 56% of the eligible population and 46% overall for the county. So that's slow but still steady improvements happening week over week, so that's encouraging news. And of course, in all the categories that we talk about, slow but steady improvements, I'm actually a little optimistic that maybe the messaging is working a little bit. The 12 to 15-year rate is starting to increase. We saw some numbers increase. We were 2 weeks ago, I think, at 30%, then last week 32%, and this week 35%. So that's great news. Every drop fills the bucket, and we need to make sure we get our kids vaccinated and get them protected. Our efforts continue all across. There's so many different sites now that are helping with the vaccinations that it's kind of hard to fit it all on the slides. So the link to the website is there, tarrantcounty.com/vaccine-finder. Those are a lot of public-supported sites. We have TCC that's launched some, and I think this week they're going to finish launching a total of 5 sites. We have partnership with Fort Worth. They're doing a lot of pop-up clinics in a lot of parts of the city. Our teams are doing a lot of mobile pop-up vaccination sites all across the county. Arlington's helping. There's a few other community partners like MedStar, JPS, and many others that have helped us throughout and are continuing to help with these efforts. So it's having a collective impact. Our pop-up calendars here, I only show you like 2 or 3 weeks, but we're booking out into late October, early November. So there's interest there in certainly getting vaccines done. It's a slow go, but it's going. Mobile testing operations. Of course, we had the holiday on Monday. And in the meanwhile, a lot of testing capacity with the large vendors came online. The county launched 2 large testing sites, one at Resource Connection and one at the Northeast Annex. TCC launched a couple of sites, and I think more are coming online this week. UTA made one of their sites open to the public. So there's a variety of different things that happened over the course of the last week. And as a result, we're seeing the impact of that. Our mobile testing numbers did decline a little bit, which is good news. That's what we wanted, because those sites are not really designed for a lot of volume. They were designed to get us to this point where larger capacity can be brought online. So we'll be working over the next 2 to 3 weeks to try to start to fold those out, especially the outdoor operations first. And we're buying ourselves more time to have more sites come online, because there's plans to bring more sites online. So again, too many of those to list on a slide, but they're available at tarrantcounty.com/COVID testing. And it's the same pattern. City of Fort Worth helping, a lot of private entities are helping. Of course, TCC, UTA, all these partners are helping. So there's a lot of choices now for people to go get tested. So if you think you've been exposed or you're getting symptoms, you're not sure what it is, let's go get you tested. Don't wait, because knowing your status about COVID helps prevent the illness. You're supposed to take action. Quarantine at home if you're sick with COVID. Don't go to work. Don't spread it to coworkers. All those type of things. And then, of course, if you're seriously ill, go get treatment. Now there's those infusion centers, and there's in multiple spots. I believe MedStar opened one. We had talked about the State Infusion Center. A couple, 3 hospitals in the area. I know THR has one, Baylor has one, JPS has one. So there's plenty of choices on that as well. So let's get the appropriate treatment. And of course, if testing's needed, go there. But my push is going to be, let's get vaccinated. So that's all I have, and I'll be happy to answer any questions.
Yeah, Vinny, I do have a few questions for you. One is, can you remind me what the process is if someone were to test at home and they wanted to let our public health department know of the status of that test, particularly if it's positive? What's the process for that?
Yes, so we have a self-reporting tool on the website. I'd have to go look at the web address, but I think it's something like self-report or case report. I'll bring it to court next time. Okay. And you can go online. It's easy. You can fill out a case report. You can talk about whether you got a test result from a provider or did you do an at-home test. I think there's a way to put an attachment there, like if you want to take a photo of a test and put an attachment. A lot of those at-home kits actually have a web address. Some people use it, some don't. But you can actually get a virtual visit with a provider, and they actually give you a test result on an electronic portal. Those are what are confirmed or official results, because a provider observed you do the test on a Zoom call, and they have a sort of an electronic medical system that documents that, and they give you an official result. But people can just do it at home. It's not required. And they can take a photo, attach the photo on. We're happy to take it any different way. That's the easiest way. You can call our hotline. They'll document everything, but if they don't see the test result itself, then it's just a report that we'll try to further investigate and see what can be done. But we need to be able to verify that test result's accurate, and that's why the photo becomes real important. But people have done it every different way. Most of our cases are coming from confirmed laboratories or case finding through other means with the contact tracing.
Okay. Thank you for that. Second question is related to your mention about the infusion center. A few weeks ago, I had asked about specific instructions if someone is uninsured or doesn't have a primary care to provide their referral. What are their options?
Yes. So the only one that I found that actually needed a referral was that state-supported infusion center, because they don't have a medical provider on site to help with that. So they needed a referral to go to that infusion center. And I think it's the old Kindred Hospital facility that's now under Cook Children's. That's the location they picked.
On 8th Avenue?
Yes. And they have a capacity, I think originally was 90 a day. I don't know if they've bumped it up. But that's where you needed a referral. There's no cost. But they needed an appointment. Other ones, though, like at Baylor, THR, JPS, most of them are walk-in style. They don't need you to have a referral because they're in a hospital setting where there's medical providers there. If you have a positive test result, you're sick, bring the result, and they'll be able to handle that. As far as the cost concerns are there's no cost to the person because, of course, if you have any kind of insurance, they'll take it. If you're uninsured, I got told by one of their hospital CEOs that currently there's a federal mandate that is helping a lot of costs being covered. You're temporarily eligible for Medicaid, is what I got told if you have COVID. So it's so outside of my swim lane. I'm kind of repeating what they told me, but they're the ones that handle all of that at the hospitals, and they said we're not charging a cost to the person to come in for getting the infusions, because there's other avenues to get paid for that. So there should not be a barrier. Again, it's no cost to the person.
Okay. Is there one location where I can send my constituents to if they want to see what their options are? Is there one website or a map, or how is that coordinated?
I will find out if we have it on our website. I know the city has at least one or two listed on their website, but I'll gather all the resources and put it on a slide next week. But generally, for now, since people do listen to this, it's at JPS. I think it's at their urgent care. Baylor has it at their ER. I forget the street name, but the Baylor All Saints location downtown. And then across the street, there's THR. All of them have the infusion centers. I'm sure there's more that I'm not aware of, but those are the big ones that we know people have gone to and have had good success.
Thank you.
Vinny, I'm very concerned with your discussion about COVID in children.
Yes, sir.
And the fact that all of the pediatric beds in North Texas are full.
ICU beds, yes, sir.
And the fact that all of the pediatric ICU beds in North Texas are full. I'm concerned that our kids are out there and have no protection. I'm concerned that we be able to keep them in school because they lost so much learning time last year,
yes, sir,
being out of school and trying to learn virtually when there was nobody there to help them. It seems to me that it is critical that we keep our children in the classroom and that we try to protect those children and those teachers while they're in the classroom. The only tool that is available to give them any sort of protection is the wearing of a mask. Now, the Fort Worth ISD issued a mask requirement that went into effect yesterday morning. Before lunch yesterday, the Second Court of Appeals issued a restraining order upholding the governor's overreach in taking the authority away from local units of government to respond locally to the pandemic. I would urge Board of Trustees President Toby Jackson, the rest of the Fort Worth ISD Board of Trustees, Superintendent Dr. Kent Scribner, to ignore the temporary restraining order issued by the Second Court of Appeals. The late Congressman John Lewis admonished us that when faced with an unjust situation, it is your responsibility to get in the way, to get into trouble, to get into good trouble. This is good trouble we can get into on behalf of our children.
Where's your mask?
My mask is right here, and when I
You
finish
will not-
speaking, I will wear it.
You will not interrupt the court or you'll be asked to leave. Is that clear?
Fine.
Finishing my point. If somebody has to face the consequences of going to jail for ignoring the restraining order, I, for one, will be willing to go over there and go to jail with the Board of Trustees and the superintendent. It is that important. I am done, and I am putting on my mask. Where's yours?
Thank you.
Any other questions of Vinnie?
I'm sorry. It was one of the things that I intended to actually talk about as well. I don't have any papers there.
You need to fill out.
There wasn't any more by the time I came back to get another.
Okay, I will ask you to come forward. We are past the time, but I'll allow you to come forward, and you will need to fill out a form upon completion of your 3 minutes.
Yes, sir. I do not intend to take 3 minutes, actually. And it is still based on the very valid points Judge Roy and Commissioner Roy Charles Brooke made concerning the COVID and our kids, the pediatrics. Like I said, I have a 10-year-old who goes to White Settlement ISD, At least for them, they could not be vaccinated. At least we can make a mandate for those kids who are yet qualified, who are not qualified to be vaccinated. At least for those sect of kids, we know 12 and above are already vaccinated and they're doing good. And I see reports every day, I receive reports every day from White Settlement ISD talking about 12 kids being infected in a day, within a week. And it keeps increasing every day. And like the doctor said, the beds are full. My wife works at the Harris Hospital, and our whole unit has been converted to COVID unit. The beds are full. People are calling from different areas of the world to ask if they can bring in their home patients. What I'm saying in essence is, for the sake of our kids who couldn't be vaccinated yet, I would urge this body to at least try on the mandate for those kids, at least those who are not qualified to vaccinate yet. Thank you, Commissioner.
This is a very difficult issue. I very strongly support local control, and I believe that those decisions should be left up to the local school boards, to the local cities, to the local county. Our governor has chosen not to do that. I regret that he has taken that position, but that is the position he's taken. And as we watch this being played out in the courts, both at the state level as well as at the national level, it's very frustrating that it has become such a political issue. I understand where you're coming from, Commissioner. It, again, is one that I wish that we were allowed to decide locally and not have someone deciding it for us at the state level or at the federal level. Moving along, Mr. Manius.
Thank you, Your Honor. On that particular item, we do have an audience participation form from Mr. Buchel.
No, I believe he's asked to speak on vaccines,
Okay,
which will be a briefing item that will come to them a little bit.
very good. Thank you.
I'll just add, as by way of an announcement regarding this particular topic with the vaccinations and the testing, is that, of course, Tarrant County College has already started to provide testing in the community. In particular, the Southeast campus that is located in Precinct 2 will start their testing this Thursday, September 16th. They have a Monday through Thursday schedule from 10 a.m. to 7 p.m. We'll be posting, sharing information about that, and of course you can visit the Tarrant County College District website for more information. Thank you. That's all I have.
So, members of the court, also on item number 6, we did provide you with the weekly update from our office. I believe you received it yesterday. It's in we filed it with the court this morning, and we're asking for the court to simply receive and file that document.
Move to receive and file.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
On item number 7, Mr. Schaffner is going to make that presentation.
Thank you, Mr. Manius. Good morning, Judge and Commissioners. We are here seeking you to receive and file the Tarrant County Recovery Plan Performance Report that staff submitted to the U.S. Treasury on August the 31st in compliance with all U.S. Treasury guidelines. This report demonstrates the work that Tarrant County has currently done with our state and local fiscal recovery funds, and it also outlines the work that is to be done over the next, general contours of the work to be done over the next year, and so we are seeking your approval to receive and file this item.
Move to receive and file.
Second.
Is this that spreadsheet that you were?
No, sir.
Okay. Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And when is the next report due?
So the next recovery plan performance report is due August the 31st, 2022. But we will file the required quarterly reports are due on the next one is due on October 31st. We have a very aggressive reporting and evaluation timeline for this.
Okay.
So, and also just wanted to say thank you to audits work, budgets work, and the administrator's office work to get this thing done.
Yeah.
So thank you all.
So, members of the court, on item number 8, Ms. McMillan is going to make that presentation to the court.
Good morning, Judge Commissioners.
Morning.
Today we're asking you to consider a resolution providing approval of the issuance of multifamily housing revenue bonds in one or more series by the Tarrant County Cultural Education Facilities Finance Corporation for Hope Housing Foundation in an amount not to exceed $42 million. The Hope Housing Foundation is a Texas nonprofit headquartered in McKinney, which provides affordable workforce housing to low and moderate income family and individuals. The proceeds of these bonds will be used to finance the acquisition, rehabilitation, and equipping of 3 multifamily residential projects, each of which is intended to partially house persons of low or moderate income. 1 project is located in Dallas, and 2 projects are located in Port Lavaca, Texas. Approval is for the issuance of the bonds solely so that the bonds can be tax exempt under the Internal Revenue Code, and it does not create any liability for repayment of the bonds to the Commissioner's Court.
Move approval.
Second.
We have a motion and a second. Why are we doing this?
Well, we do issue bonds for projects that are outside of the county.
I understand that, but I guess that question then could extend to why are we doing this?
Because it's for a public purpose, and it is allowable under the Cultural Education Facilities.
But do the other do these other counties or do these other entities not have similar deals? And
I can let Randy.
in all of these situations, have we gotten concurrence from the counties and
Yes.
from the cities?
We have concurrence and approval because the projects are located within Dallas and Port Lavaca. Then that requires that the county judges of those counties approve, just like we do a TEFRA approval when other corporations are financing projects in our county. And those two counties have given approval for these bonds.
So we have copies in our records.
Yes, we do.
Of documents signed by those other county judges.
Yes, sir. They do a resolution of approval.
And we get a fee? And we get a fee?
Yes, we do.
Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Tidwell?
We have one item we're asking the court to consider this morning, and that's to receive and file the Tarrant County financial statements for the 10 months for the period ended July 20th, 21.
Move to receive and file.
Second.
We have a motion and a second. Mr. Bucher, you wish to speak to this item?
Which item is this? I'm sorry.
Audit of July financial statements?
Again, Robert Bucher. When I looked over the audit, I seen quite a bit of things that we can start scaling back on, and this kind of is more of a suggestion, than anything. Like looking at the $2.5 million spent in storage rooms. I mean, do we have any available buildings that are not being used that the county may be paying for that maybe we can start scaling down? Granted, it don't cost a lot to move things for this area and this area, so that way we don't have the people driving all the way over there to grab what they need here to go to there. So I'm just kind of curious, can we start scaling back in those kind of areas? I mean, we're spending $15,000 on pop-up vaccination sites. I mean, pretty much everybody's kind of aware of that issue right there. And I mean, those are things I feel like we can scale back. And spending $1.5 million on advertisement for COVID, I'm pretty sure everybody, unless you're in the mountains, is pretty, familiar with COVID. Those are just a little bit of things that we can start looking back at scaling. And that's just kind of what I want to speak on that.
Thank you, sir.
Yes, sir.
Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Ms. Glenn?
Move to receive and file the personnel agenda.
Second.
We have a motion and a second to receive and file the personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Good morning. We have several, it's still morning, we have several items for the court this morning. The second item, we're asking the court to consider some changes to the salary administration guidelines. As explained in your court communique, these revisions relate to the relationship of the magistrates and the associate judges, their salaries, to the state district judges. Just as a reminder, currently what our guidelines call for is that the magistrates and the associate judges' salaries be capped at and will not exceed 90% of the total district judge's base salary, and that would be their salary including the county supplement. So that's the current verbiage.
And that base is that's a new elected state district judge. That's what the base is.
That would be the base.
Okay.
So what criminal courts administration is requesting is that language that you all consider changing, the language from 90% of base to 90% of max. You have an alternative proposal, if you like, and that is to leave that language in place, but move the percentage from 90% to 95%. So that would be the revision if you want to consider that as an alternative. It is important to note, though, that for fiscal year 2022, All that's being requested is the 3% adjustment. And so that revision, if the court chooses to make a revision, would basically just move the cap a little bit, either way, or maybe a lot if you change base to max. So that's what's being requested, and again, you have an alternative proposal.
Well, and I will just say that if you go with 95% or 90% of the max, that means you're going to have associate judges who are making more than the elected judges as they begin the process, and probably well into the process if you go to the max. And quite honestly, so it then becomes, you begin to discourage associate or magistrate judges from, or anybody, for running for an elected office, and instead they serve as an associate position, and they're not elected. So, I certainly don't feel comfortable with the change to the max, and I don't feel much better about the change from the 90 to the 95. I feel like there needs to be some separation in there. And, we've allowed, I guess we put the associate judges on there to give some assistance and help to the district judges and to the other judges as their volume or as their increases, but I really don't want to get it to the position of where basically, okay, I can do this, I don't ever have to worry about being elected. I can just, be comfortable with staying just right below those judges that are elected. So,
and of course, the court can certainly make a decision just to leave the language as is.
Judge, I agree with you. I don't see any reason to do this at all.
Well, I'm in support of the 90 to 95%. So I'll make a motion.
There's a motion, but it dies for lack of a second, so let's move on to the next item.
So the next item is item 3, and we'll go past that one and come back to it. So let me hop to item 4. Here we're asking the court to consider an extension for the use of reserved time off, and this is GK's favorite leave time. So the court may recall that last year at the beginning of the pandemic, we came to the court, actually the court asked us to agendize an item, and the court agreed to grant employees who worked either on site or remotely for a specific week that was designated April 8th through the 14th of 2020. So what the court said was that any employee who worked, again, either on site or remotely, would earn 40 hours of what we call reserved time off. In our system, we call it RETO, R-E-T-O. And so that was approved. Part of the stipulation was that for any employee who earned that time, that employees would have to exhaust that leave by the end of this month, September 30, 2021. So we're at September, obviously not at the 30th yet, but we have right now over 800 employees who've not exhausted all of their RETO time. Some have 40 hours, some have less than 40 hours. I have a few employees in my department who have what we call RETO balances. So what the court is being asked today to consider is to extending the deadline for the use of that time to September 30 of 2022. And so that should give every employee who earned the time back in 20 to use that time and certainly not cause a disruption in their department.
Move for approval.
Second.
We have a motion and a second. Remind me again exactly how we accumulated this. You said a particular week. What was the? Give me let me dust off the
Sure,
top of
it's been a minute. So again, you'll recall this was when the pandemic first started, and so we had some employees who were working on site, but we had quite a few county employees who were working from home. And you'll recall that we had something called pandemic time off Do you recall that?
No.
You have to reach far back. And pandemic time off was time that was granted, it was paid leave that was given to employees who were sent home and who were not working from home. So they were getting paid, they were at home because, of course, that was the safe place for them to be. And what the court decided to do was that they wanted to award an extra week of time to those employees who were still working, either on site here at work or working from home. And so we created what's called reserve time off. And for you all designated the week of April 8th through the 14th. And somebody from HR is going to correct me if I have those dates wrong. That's my recollection. And so for employees who worked during that period of time, during that window of time, they earned 40 hours of reserve time off. Again, the stipulation was now it's in your bank and you have until the end of September 2021 to use it. And we just have a large number of employees who've not had an opportunity to use their time. We have quite a few people in the sheriff's office. We know that they're hardly getting any time off, so they're definitely not going to get reserve time off. We have, I think, a fair number of employees in our public health department. Obviously, they're all wearing lots of hats these days, and so they have these balances that they've not had an opportunity to use. I don't know if that helps, but I know it seems like 10 years ago, but it was actually just in 2020.
Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. So our next item is item 5. Here we're asking, or actually the district clerk is asking for a waiver of terminal benefits. His accountant has resigned from county service. He has named a replacement and is eager to get that person working. So the waiver, working in the accountant's position. So the waiver is for 133 vacation hours effective the 18th of this month. We're estimating a cost to the general fund of approximately $6,205 and some change.
133 or 173?
I believe it's 133, but I'll double check.
So I believe it was initially at September 10, it was 173.
And some of that time has been whittled down because
133.
Yeah.
Okay.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Next item is item 6. These are a table of organization changes to Criminal District Attorney's Office, Criminal Courts Administration, Domestic Relations, Information Technology, and the ME's office. These requests are related to, are actually requests tied to ARPA funding. Your court communique, and I'm trying to find mine. Specifically, the Criminal District Attorney's Office is requesting 11 positions, Criminal Courts Administration 1, Domestic Relations 3, IT 3 positions, the ME's office 1 position. All the details, of course, are outlined in your communication. As I mentioned, these positions, if approved by the court, would be covered by ARPA funding. As a reminder, just as with any special fund grant funds, we make it clear to employees who are hired into those positions that those positions are available as long as funding is available. So that will be made clear here as well. We're estimating the impact to ARPA funding to be approximately $1,863,697.
And this is in keeping with what we've already been briefed on in terms of these positions being funded by ARPA. So this isn't anything exceptional to that.
There's nothing exceptional, and the process that we have in place is that what I'm going to call the Arpa Committee meets on Thursdays, and submissions come from departments for new positions related to funding, build-outs related to ARPA-related projects, and so these positions went through that process.
Move for approval.
Second.
What I would so these are all project employees.
No, sir, these are full-time positions.
Well, then if they're full-time positions.
Grant-funded.
Full-time.
Well, they're grant-funded for as long as we've got the ARPA money.
That's correct.
So then they go away. Okay.
Yes, sir.
That's what I meant. So project means that's
Yes,
a
sir.
different term.
Yes, it is.
Definition. Just a couple of things. And I mentioned this last week. To date, I think we have, as a court, authorized the spending of about 107 million of our $408 million. And so what that committee is doing, and they're doing a very good job of making sure that as requests are made, that they would qualify for ARPA funding, but they're not passing judgment as to whether or not they feel like that is in keeping with the priorities that we as a court have set or discussing having set. So when something comes through there, that's just basically a department saying, I need this person. And I believe this person's could be paid for through the ARPA money. And so I'm just nervous at the fact that as a court, we have authorized the spending of $107 million thus far of our ARPA funds. And I'm not sure we fully understand the details of what that is. The second thing that I would say with regards to any one of the personnel that we hire, because it is my understanding that in just about every one of these positions, that their sole activity needs to be ARPA related.
That's correct.
And so I'm going to request that any employee that is hired under this scenario, that not only does the employee get briefed on exactly what they're supposed to do, but the supervisor and the department head, all three, acknowledge in writing that they understand that they're only supposed to do things that are ARPA related, so that they don't deviate, and so that all of a sudden the supervisor isn't saying, well, go over here and do this for me today, and that doesn't qualify under ARPA. So I want all parties involved, from the employee to the supervisor to the department head, to acknowledge that in writing before we allow someone to come on board to fill that position.
And I think we have a document, Judge, that will meet the needs with some tweaking. Currently, our process in HR is that when we hire any employee in any grant, for any grant-funded position, there is a standard document that where the employee acknowledges that they are being hired into a grant-funded position, and then that position is only in effect as long as the grant funds are in effect. I hear what you're saying is to go an additional step and add to that document, and I recognize and acknowledge that I'll only be involved in ARPA-related duties or activities. So I hear what you're saying, and I think, again, we're more than 80% there with the document that we have in place. So we'll work on it.
Yeah.
Go ahead.
A couple of things. I don't know that I was surprised by that number based off of information that staff has sent and also conversations that I've had with budget and with Russell and a few other folks. Now, I understand and I share your concern about making sure that for these positions that are funded by ARPA, that they are doing ARPA work and only ARPA work. I had shared that, I don't know, several weeks ago in one of the meetings about kind of where we were with the process. I don't know that I understood. Let me say it this way. I understood that the work that the committee is doing in making these evaluations is still within the context of the 4 focus areas that we as a court adopted. What I heard from you is that you understood that they were making decisions outside of that scope. So, did I hear you correctly?
I don't know that they're making decisions outside of that scope, but when they come to us, there may be things in there that would qualify for ARPA that we might decide as a court that we would rather pay for through the routine part of our budget.
Okay.
As opposed to using ARPA funds, because one of the things that I have said time and again and that we've talked about from time to time is that I think we have a once in a lifetime, I hope, opportunity to take some of these funds and spend it on such things as the Mental Health Jail Diversion Center that we might not otherwise have done had it not been for the ARPA. And I think that as I look through some of those things I believe that we would have done in the normal course of our budget, and I'm not sure I would say, even though it might qualify for ARPA funds, that I want to spend ARPA funds on that particular item. And I think what that committee is doing is saying, yes, we believe this qualifies for ARPA expenditures, and is not passing judgment on whether or not it's something that would be within the budget. Now, Russell?
Now,
who's the committee?
My concern, Glenn, is that, yes, the committee is determining that the positions meet ARPA funding requirements, but there's a missing step somewhere. Somebody needs to look at whether the positions are necessary. There is no justification statement anywhere for any of these positions that I've seen.
Well, I mean, I saw a whole spreadsheet of information that talked about the departments, the positions, and the justifications. This was like, I think, prior to our first budget hearing of our regular budget, where we were evaluating requests through the normal process that were ARPA eligible, and then also in addition to that, some things that came up in just the ARPA evaluation process. So I don't know what I'm missing, but.
Well, and it may not be anything, but I guess I just want to be sure. I've sat in one of those meetings, and your question was who all's in that meeting. And I mean, we've got people from budget to audit to the administrator's office, purchasing, facilities, the DA's office, public health. It's a wide array of folks. But I just, when I was sitting there and saw some of the numbers run across, I just hadn't fathomed that we as a court had authorized the expenditure of over, at that time it was over 90 million. Now, after today's deal, it will be over 100 million of potential expenditures. And Russell, potential expenditures may not be the right word, but in effect, I think tell us what we have.
So first off, we're going to have a detailed discussion of where we are regarding the state and local fiscal recovery fund allocation process during the work session. So that'll be the first part of the work session. We're going to hand out spreadsheets that you all will get shortly, and we will walk through in as much detail as what the Commissioner's Court would like, that particular spreadsheet, and then what the committee has recommended, and the committee meets to recommend, or the work group, we're not technically a committee, we're a work group, meets to make sure of all the various aspects of the evaluation processes, the compliance processes, all of those items meet what the Commissioner's Court has laid out that they need to do, meet the federal reporting and evaluation requirements, and then make sure that the department that have requested items are meeting the standards that we are trying to set out in order to have a robust and efficient and effective evaluation strategy. Once that happens and occurs, it is recommended by the committee. We have a process there's a great deal of documentation, and then we start to put things on the agenda as we have described to you in previous work sessions to work through that. Now, as part of that, we do the budget, audit, admin does look through and vet to make sure that these are items that are FRF eligible and that they have a substantiated need. Each of the positions that you all have approved and are going to continue to approve will be evaluated during the normal budget evaluation processes for FY23. And all the positions that y'all are authorizing are authorized through June the 30th, 2022. And the reason is because on June 30th, that's the end of the reporting period. And so we'll go through a year with these positions. The departments and those positions will have to substantiate that the work that they are doing is COVID mitigation activities allowed by the feds through the U.S. Treasury, through the interim final rule, and hopefully we'll have a final rule within the coming months. So there will be a robust and very, very complex evaluation criteria that will be met in order to move those positions further along the road past this particular one. So that's just kind of a general overview of what we are doing. Again, we're going to get into much more complicated or much lengthier discussion later.
Just for the court's information, when we first set up this committee, I had some of this. We had our office, this working group.
Thank you.
Thank you, Commissioner Allen, for pointing that out to me this morning. We had the same concerns you all do, and so what we wanted to make sure is that while this was not a normal budget process like the court normally does with its general fund, that applications had to come up through the budget office so there could be an analysis of that, and to make sure everything that Russell talked about, that it fit, but also that we're going to require that they do KPIs, key performance indicators, to make sure that they are functioning and they are needed. And that's the best we can do at this time, and we can do that, and none of these positions are guaranteed for more than a year. And so we will have those key performance indicators and to determine if in fact funding of that position was something, two things. We know it has to be ARPA related, but also that it's performing tasks that we could not perform with the existing personnel.
And I understand that, and I appreciate very much that. The thing that I wanted to be careful of is, for example, if we were looking, if any one of us had ideas about whether it be small business grants, whether it be rental assistance, whether it be other, I know that there are certain things that we have to do and we had to do immediately. Vaccines, testing, things along that type lines. But as we, what we could find is that while it would fit in one of our four pillars, it might consume our budget in those four pillars and not leave us funds to be able to do things that as a court we had anticipated doing with those funds. And so I wanted a better, and I hope that we can get a better, and the spreadsheet may very well be it, but something that gives us a better, at a glance, here's what we've budgeted, here's kind of what we have potentially obligated at this point in time. So we've got a lot of positions that we've done. We've not hired them yet. And so I guess what I would just like to say to everyone is, as we begin to look at that, if we do feel like that we have overcommitted in a particular area, we may be coming back and rescinding some of the things. I noticed some people looked up at that word. We might be rescinding some of the things that we had previously approved, just so that we can have a better, we haven't gotten the needs survey back yet. And yet we've spent, or potentially have obligated, 25% of our total.
Budgeted,
we have authorized the expenditure of approximately 25% of the total amount of ARPA money that we are to receive in the next, have received and will receive in the next 12 months.
So I think I understand what you're saying, and you want some as great of information as we can provide at the time for the court. So let us work on the spreadsheet. I will tell you that some of the expenditures are expenditures that, for example, the mental health, the jail diversion program. You know, the acquisition of the facility and the 2 years operational budgets are part of this 100.
Yeah.
And so there's that, I'm going to say a one-time expense, but as of today, those are one-time expenses, and those were 20-some-odd million dollars. I do think that we might want to put a chart together so that at the very minimum on a weekly or bi-weekly basis that we can provide you with those expenditures, how we're spending that money down. That'll give you a much better visual, and it'll create greater transparency. If that's what you like, I think that would be a good thing to do.
And dividing it up between personnel, between capital, between programs that are, you know, where we're giving the money out to other agencies, to other organizations to provide some of the services that we believe are priorities.
I tell you, well, yes, absolutely. What we'll do, let us start developing that spreadsheet, and then I know we'll ask you to have input, the court to have input on if there's some modifications you need on those spreadsheets.
Helen?
I just want to address Commissioner Brooks' concern. What we're presenting is not everything that everyone asks for. We're vetting it out. We're seeing if it's needed. We're looking to see. We're asking for stats. We're asking for information. And sometimes what we've presented to you as of today, we started working on 2 months ago with the departments. So yes, sir, it is being vetted out that it's not only ARPA eligible, but it is also something that is needed position-wise for the county. And capital, we're doing that also, but you were addressing positions.
Okay. Yes, ma'am, thank you.
Yes, sir.
So I believe we have a motion and a second. Is there any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. And if we can go back to item 3, Ms. Worthy will present that item.
Good afternoon.
Hey, Rob.
So I'm back on quarantine and isolation policy. So we are here this week to revisit this. As you know, you approved the quarantine and isolation policy related to the House Bill 2073. We had some discussions, we had some requests. We wanted to come back to you and seek clarification as to whether we wanted to include employees in our juvenile detention center to qualify for this type of leave. Of course, it is not officially called a jail, and they are not called detention officers, but there are individuals that are incarcerated and taken care of by county staff. The House bill is not exclusive or inclusive of those individuals. So the advice we have received is it is permissible to include them should you wish to do so. And that is what we are presenting here for you. Happy to try to answer questions or discuss this.
I can't think of any justification for excluding those employees.
We're still working in a congregant setting, so, yeah.
I think that was a motion and a second.
It was a motion and a
You
second.
may consider that to be, yeah.
Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Purchasing. Good morning.
Good morning. Afternoon.
Yes, sir. Yes, ma'am.
Hey, Melissa.
We have 4 items for your consideration. The first item is an award recommendation regarding bid number 2021-125. This is an annual contract for the medical examiner supplies for the Lee's office, awarding to the primary, secondary, and alternate vendors listed in your court communique per unit price and discount for items not listed.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes 4-0. Please show that Commissioner Allen was not present for this particular item.
The second item is also an award recommendation regarding bid number 2021-131 for the purchase of AV equipment for the mobile displays for information technology, awarding to Pro Sound in the amount of $95,166.25.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes 4-0.
The third item is a request for approval of invoice payment to artwork layouts for the WIC clinics for public health to Sign Text Signs and Graphics in the amount of $875. WIC directed the vendor to provide services before requesting approval from purchasing.
Move for approval.
Second.
So who are we saving $875 for? Is that Vinnie?
Well, WIC is a division of public health.
You can thank us later, Vinnie. We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes 4-0.
And the fourth and last item is regarding bid number 2021-136. This is our annual contract for signposts and anchor material breakaway style for all precincts. We're requesting rejection of all bids and request permission to rebid with revised specifications. This is due to the global shortage. There has been a large increase in steel prices, so we would like to rebid in early 2022.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Now, had Jack been here today, I believe that he would have either been wearing a hog head or he would have been convincing somebody who represented Texas. I see that my chief of staff is, and there's my former chief of staff.
And I had about a 45-minute conversation yesterday.
Yeah, well, I figured that. And Shannon's missing. I noticed that there's others missing today. So
I'm sure he wanted to be here for that.
I'll bet he would have loved to have been here for that. Thank you very much.
All right.
Are there any appointments today? There being none.
Your Honor, are we had that one item under the Sheriff's Department that we had pulled off of consent.
Well, I guess maybe we need to go back and talk about that.
So we did have an audience participation form on that.
Okay, I'm sorry about that. That would be item K4, approval of a lease with the Tarrant Regional Water District for the livestock stray enforcement program.
So, Your Honor, we're asking that the Commissioners Court approve the lease agreement between the TRWD and the Livestock Stray Enforcement Program, which is administered by the Sheriff's Department. This particular one is a continual contract that we have. We provide stray livestock enforcement through the SO, and there is a need to board the livestock that we actually have to go out and capture and recapture, and that's what this particular item is about.
Come on up, Chief. Anything you want to add?
Well, no, sir. Other than the fact I believe this new contract with the Tarrant Regional Water District is actually a slight decrease in the contract, and there's some savings financially.
Thank you very much. Thomas, come on down. Three minutes.
Judge Whitley, Commissioners, I reckon y'all don't know this, but I'm probably more cowboy than anyone in this room. I built a pond or a lake in 92 Texas counties. So I've been around a lot of cattle and livestock, and I've seen a lot of BS. In the interest of decorum, I'll use the term bovine scatology. The reality is that this is just a little lease to TRWD. You remember Miss Doreen Geiger that came last week? She said Geiger like the counter. It's not because she's good at detecting treasures under the ground. It's because she's really good at detecting bovine scatology. And part of my point and criticism is the Sheriff's Department has the responsibility, along with the District Attorney's Office, to also provide a public integrity unit and has to handle specific offenses that Ms. Geiger has already outlined and shared with the Sheriff's Department. You know that...
We're talking about the contract for a stray. Let's not stray.
Sir, I can talk about anything. I can recite poetry for 3 minutes.
No, you're not going to talk about other items.
All right.
At this point in time, you're going to talk about
the stray program. That's right.
Program.
Right. So I want to discourage leasing from TRWD specifically until they get control of their strays at TRWD. They've strayed so far from generally accepted accounting principles, ethics, morals, and they've mismanaged money so much that I reckon there's a lot of other properties, especially in northwest Tarrant County. The strays that are included are a rogue law enforcement agency who doesn't have a certified chief. And if you get into the invoices, including for rentals and land leases, you'll find that the law enforcement officers' names are on some of those invoices for work performed on their residences. So lease any other open cattle land that you want. But until somebody dives in, including the sheriff and his public integrity unit, I don't recommend spending any money at TRWD.
Thank you, sir. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
We didn't have a motion.
Well, I guess we probably need one of those.
Yeah.
Do I have a motion?
I'll move.
I have a second.
I'll second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes 4-1. Okay. Court members, you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second?
You have a motion and a second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Briefing items, Mr. Manius?
Thank you, Your Honor. Members of the court, one of the requests that we had last week from a court member was to put on the agenda the possibility of a vaccine incentive program. And we have provided you, I believe that we sent that out yesterday, some of our staff recommendations. We have included recommendations from budget, from audit, from the district attorney's office, and also the county administrator's office, and we have provided that in a memorandum. I think I would probably want to ask Mr. Schaffner, would you come up and talk a little bit about this? And that should be we put that also in your electronic book. It's under briefing.
And if not, we have hard copies.
The employee one, where did that come from?
That particular one is from HR, but there is a second one, and it's attached to a court communication that should be in your.
Got it. Thank you.
File.
No, I have it. I'm just trying to make sure. Thank you, though. Got it. I need it. Too much paper.
Thank you, Mr. Manius. Staff has, as Mr. Manius said, staff has provided a memo that outlines what vaccination incentive programs look like in a couple other counties in Texas, Dallas County and Harris County. And then the memo also asks for feedback on key policy questions if court so decides to desire to move forward with a vaccine incentive program. I believe this starts on page 3. So I believe we have 7 items that we can walk you all through and get feedback. And the first question is, should Tarrant County proceed with a vaccine incentive program? Is there a desire for the court to move forward to develop such a program?
My answer would be yes.
I agree. I would also like to see us move forward with that.
So I tell you what, before we do that, let's just walk very quickly through what Harris and Dallas County.
Okay, sure, absolutely. So Harris County in August began a program that was specifically related to Harris County public health vaccination sites. I believe this is on page 2. And the initial program that was developed would allow an individual to come to a Harris County vaccination site, be vaccinated, and for the first dose receive $100 through a gift card, or through a cash card, or through a physical cash card or an electronic card that I believe that Zelle was the provider of how those funds went to the individual from the county. They did use FRF funding for this item. Their Commissioners Court later on, after seeing the response, and increased the size of the program and opened up a portal to allow any individual in Harris County to be able to report that they received a vaccination within a set time period, and they were able to receive an electronic gift card or a mailed physical gift card. That program is ongoing. As well, Dallas County has a little bit different structure to their program. They received donations of Six Flags tickets and Dallas Zoo tickets, as well as purchased about 16,000 $25 Walmart gift cards, and they are handing those out as individuals are vaccinated at their Dallas County public health sites.
Now, Harris County's program is for first shots only?
That's my understanding.
What about Dallas County?
I am unsure if it's just first shots.
It says their first or second dose of COVID vaccines.
It does say that.
Then that's what the program is, yes.
Okay.
I apologize for misspeaking.
Well, we've been attempting to move the needle, and quote unquote. I think this might be an incentive. There are other things that I would like. If we choose to discuss it further, then I would like to, talk about some of the hurdles that I've tried to get through, and at least consider in my mind as far as what I would like to see done, and get everybody else's thoughts about that. But I would like to see us try to do something to incentivize folks to get the vaccines.
I think that the only way we're going to get past this pandemic is to get shots in arms, and we have not been particularly successful in getting above the 40 to 45% vaccination rate. We've got to get much higher than that, and if it requires incentives to get there, I'm prepared to try it.
If the silence from the other three indicates that you're not willing to do it, then I don't want to go any further. There's no reason for us to spend a whole lot of time discussing it.
I don't support it. I think giving somebody $50 who will tell you today they don't believe in vaccines, they're scared of a vaccine, but $50, yeah, I'll take it. I don't buy that. They get the first one, they'll want 100 to get the second one.
No, they don't get, well, again, that would be the further discussion. My thought would have been $50 when you've gotten the second. And my thought on that process is they're going to take that 50, and in I think most of the cases, there's a big number of people who are still just procrastinating. If they do get the 50, I think they'll turn right around and spend it. And so I also think it will serve two purposes. One, it'll get them vaccinated, and two, it'll put $50 back into the economy, and that could be as much as, it could be several $1 million that would be put back, and most likely it's going to be in those businesses like restaurants and different things along that lines, which are the ones that are hurt the most by this whole COVID pandemic.
I think it's bad policy.
$50 for another
I think it's
shot.
bad policy. So,
say again, Commissioner Johnson?
Said it might be $50 for another shot.
I'm willing to have the discussion, but I think we have to be realistic about how effective an incentive program would be, especially at $50. I mean, right now, to fill up my car, it costs $50. That's just on regular gas. So if we have radio stations and Twitter influencers who are paying people's rent and their car notes, then we need to really be thinking about a meaningful amount that's going to make a difference for people. I don't know. I think we all hopefully realize how expensive it is to live in our county and in our region. And not that I would laugh at $50, but I don't think that's going to be enough. I also have concerns about, as what is suggested, is requiring the vaccine be received at a Tarrant County public health vaccination site. I don't know that we have a big enough footprint of that right now, and based off of where they are, is that it's not proportional enough for me to feel comfortable with, which I know obviously we can discuss this. I'm willing to discuss it, but my being open to discussing it should not be at all confused as me being supportive of the program or the idea as yet.
Do you wish to address any of, I think the question with regards to requiring it to be public health sites, that was kind of a beginning point as I understand it.
Okay.
And it was not, go ahead.
We can, for discussion purposes, perhaps we should walk through kind of the 7 policy issues, and let's kind of talk through those to see where court comes out on this particular issue. Number 2, Tarrant County residency requirement. Within programs, a residency requirement is one item that the court can consider. This would require a Tarrant County resident to be the only folks eligible for the incentive program. The other argument, so the argument could be made that given the wide diversity of folks that come into Tarrant County from all across the Metroplex, that it may be beneficial to come in to work, to play, to go eat restaurants, to shop, that it could be beneficial also to open it up to where anybody that would be vaccinated in Tarrant County would be eligible for this program as well. So those are the 2 poles of this particular discussion of the residency requirement. Whether or not that needs to be there. And again, for discussion purposes, we're not asking for direct feedback yet, but let's just kind of walk through. Vaccination site restrictions, as Commissioner Allen said, staff's general recommendation would be to initially restrict the program to be Tarrant County public health sites only. The reason being is that this is a significant program to begin, to initiate, start up, and develop. Staff wants to do this program if the Commissioner's Court wants to move forward with it correctly and meet all federal guidelines to it. Therefore, starting with a smaller subsection, allowing us to figure out how to work on it and then report back to court on what we find would be the preferable option.
I would be okay with that if they had a vaccination site at least in every sub-courthouse.
And I just want to reemphasize something that Russell said, and it's something that the committee had looked at in totality. First of all, we want to make sure that anyone that wants a shot gets a shot. I think we all agree with that. The complexity of the program itself, if we go with a gift card type activity or some type of electronic gift card activity, is that there's issues dealing with audit. There's issues as far as how do we get that to the person that gets a shot. We can control that more initially at one of our centers. So if we have to ramp up, we would do that. If we do that, that does not mean that we can't expand the process to other entities. You might think about it this way. If we have one of our centers, we will capture the data because it has to be reported to the state anyway. And then we'll have to have a process there in order to hand out the gift card. If we have a situation where someone goes down to your pharmacy and gets a shot, then we need to capture the idea of how do we get that information so that we can get the gift and make sure it's registered with the state. We can get a mailing address and send the gift card out to that. That's a big difference than just simply handing the gift card out at site. And so there's a lot of different complexities to this, and I know that the auditor can speak better to it than I have, but we've all tried to get our arms around this thing to see exactly how we can be effective in getting this thing done, if we do it.
I would hope that if we work some sort of a contract or an agreement with a pharmacy such as CVS or Walmart, that they would give out the card and we would reimburse them in some manner for that.
I'd like to speak to that since I'm on the back end here handing out those gift cards. The Harris County program, you need to understand if they receive their shot somewhere in public health, that has to be verified. And the only way to verify that is through the state registry. The person who accesses the state registry needs to be someone who's HIPAA compliant and is authorized to have access. In Harris County, their public health people were the ones that were involved with that. They created a portal. An individual who'd been vaccinated at their pharmacy could log on to the portal. They could provide the information related to their shot and information related to where their electronic gift card could be sent. Handing out gift cards to pharmacies for them to distribute has a lot of risk, a lot of follow-up, a lot of inventory, a lot of reconciliation. I don't know how many employees we would need to have on staff to do that. The Harrison County approach seems to work, even though it also requires a lot of staff. We're not opposed to opening up the program, but again, one of the reasons it's been stated for starting at the physical location was it's a lot simpler to get everything from the person before they actually leave the site. And if you can even give them the physical gift card. One of the quirks right now is there's starting to be a shortage of plastic gift cards. Harris bought a lot more than they needed, so perhaps we could buy some of Harris's. We joked about that. The electronic is another way using Zelle, and Zelle is a Chase app. Chase does not actually do anything anymore with physical gift cards of any kind. They would only be willing to do something through the app. But again, the person would have to have the app. There's just a lot of moving parts to this, and there's a lot of opportunity for misappropriation of those gift cards. Who's going to activate them, how we're going to know how many they had, how we're going to make sure they only gave them out to people that had shots. I'm not opposed to doing this program. If we could find a vendor that wanted to take it all and we could just give them the money and they could do it and then we could audit them, maybe so. But there's a lot of issues here. And again, the other counties have done it, but they've done it in a very methodical way with sufficient resources. I know public health doesn't have the resources currently to do this program, nor do I.
Okay. Well, and I was going to ask that, Renee. Do we know for Harris County and the portal that they created to verify the vaccination and the address and all that, how long did it take for them to create that?
I'm not sure how long it took them to create that. They tell the person applying it could be up to 14 days for them to verify their information and another amount of time before the money actually arrived in their cash out type location.
Okay.
You said Zelle, is it Z-E-L-L-A?
No, Z-E-L-L-E. It's most of the major banks, but if we're talking about the target audience, didn't mean to cut you off, but if we're talking about targeted in the people who we're trying to get, the younger people, they're probably going to be more apt to using a Venmo or a Cash App or one of the others, and not necessarily Zelle, which I'm not putting Zelle down, but I'm just saying we have to think about what are people actually going to use.
I understand.
Yeah.
I'm just saying that is the Chase app.
Yeah.
And Chase is our depository. So.
Sure.
Yeah.
Understood.
And Ms. Tidwell, if we could get you to make a clarifying comment on something, the individual who would, if we move forward with the program, the individual who received a vaccination would technically be filing a claim with the county in order to receive the incentive.
Yes. And so again, the distribution of the cash, once the courts determine that there's a bona fide business purpose, it's still a claim against the county, is my understanding, and I still have to be responsible for making certain that that claim is paid in some fashion.
Correct.
Again, it's doable because all these other counties have done it, but it's not something we're going to turn on next week. As soon as I found out we were going to be doing a discussion of this and before, we personally in my office talked to Harris County and others. We have another call with Harris County Public Health tomorrow to actually talk about their staffing levels and what they're finding on the second program.
And that leads us into the next policy issue, which is program delivery mechanisms. What's the balance between internal staffing up versus external looking for companies and contracts that we can go out in order to balance this particular issue and make sure that we can, to your point, whether it's Zelle, Venmo, Cash App, et cetera, how do you blend those appropriately? And those will require outside contracts. There's a lot of moving parts with that as we do work on those program delivery mechanisms. How much is the actual cash card? It's our understanding that in Harris County, the folks that are entering their information into the portal are primarily requesting it to be an electronic payment through Zelle, not a physical card, which is a very interesting point. Eligibility window and vaccine dose, 2 items linked together. The recommendation from other entities that have done these is that a specific vaccination eligibility window, such as you would begin your program with a start date and an end date. So the one that we're suggesting in the document is October 15th through October 31st. As a hypothetical, looking at...
Is that when you want to do the vaccines?
That would be a hypothetical, again, just looking at
I don't know about everybody else's sub-courthouse, but in my sub-courthouse, on the 18th, we start early voting for the November 2nd election.
Yes, sir.
Yeah, the October 15th, that has to be very fluid, because if we move forward with this, we don't have this issue or the process set up, then we're going to have some real problems. So I think we've heard everybody saying that we shouldn't establish a start date yet. We need to get the resources together if we're going to do that. Then the logistics that Commissioner Fick has pointed out is something we're going to have to look at.
My concern is if we move forward with this, the next time we have some type of issue where maybe it's a different variant of this vaccine, nobody's going to get it until you offer that incentive. It's bad policy, guys.
The corollary issue with the eligibility window is first and or second vaccine and or third vaccine. There are the potential for 3 doses. How many do you do 1, do you do 2, do you do 3? Or do you do one of the 3? So those, again, policy questions to be worked out. In the amount and type of incentive, again, others have done tickets to, like I said, tickets to Six Flags or the Dallas Zoo or Walmart gift cards, cash apps, electronic payments, those types of issues. And then finally, the vaccination incentive program funding. Where would we identify these funds to come from? We do believe that they are very likely FRF eligible, but that is another item that would need to be decided. So with that, those are kind of the 7 policy areas that staff has identified that the court would need to work through in order to move forward with any potential vaccination incentive program.
I think if we're going to do it, we need to do it rather rapidly. And if we're not, that's fine. I don't think we're going to move the needle for those folks who are sitting on the side. You know, one of the biggest things I have is I would like to find a way to be able to give money to folks who have already gotten the vaccine. I'm told that that's a little bit more difficult and that we've got to give them, we can't give them money for something that has been done. And so maybe we could end up saying you'll get it at the second shot or at the booster. I mean, we're talking at $50, we're talking about $100 million if we do not get any assistance or support from the cities and or possibly the state. I would suggest that if we were to move forward, that we see if we could enlist the cities to match or the state to match. I hear what you're saying. Again, this is a once in a lifetime type of a deal, I hope. We don't know that for sure, but we've been given a bunch of money from the federal government. And again, I see it I do see it as an amount that is not so large that it's going to encourage them to put it into a savings account or, to go out and to make a rent payment or something along that lines. I think we've got other rental assistance that we're looking at in that particular regard. So I do see it as something that more likely than not will be spent, and hopefully it'll be spent in the local area. And so it would serve the double purpose that I mentioned earlier.
Yeah, I want to make sure you don't get hung up on the rent piece. My point is that it needs to be more than $50, I think, to make even more of a difference. That's my point.
And I hear what you're saying, and my thought with regards to that is we're on the hook for 50, and if we don't just reward those folks who procrastinated, that potentially is around $100 million of, again, the 408 that we have, and I'm not probably willing to go much higher than that. And like I said, I'd much prefer for the state or for the cities to maybe match like we're doing with our bond issues, where we say we want you to match our expenditures in this particular regard, and then that way we'd be looking at 50 versus 100 in that deal.
Do we know if any of the cities in our county are planning to develop their own incentive programs?
I do not know of any that are.
Not to my knowledge.
I would just say that, in my opinion, the thing that would be bad public policy would be to do nothing.
I don't disagree. Oh, go ahead.
We spent $7 million at least with UNT Health Science Center. For $7 million at $50 a pop, you can vaccinate 140,000 individuals. I don't know if that's a big number or a little number to our public health department, but I would think it's a significant number.
Yes, sir, I agree. I mean, that would, right now, the vaccine numbers are slow. 140,000 would be a great addition.
Well, so you give them, instead of 50, we give them $100. So now we spent 14 million plus 7, and I'm not sure 7's the right number. And then you're going to spend probably double. You're going to spend at least that much money implementing this whole thing.
So,
which is fine, I guess. They come out, but I think paying them is not the way to do it. It's just crazy.
So what?
And to give them more?
If we're not going to pay them, then
If we
what?
don't, go ahead.
No, go ahead.
No, I'm through.
I guess I'm just wondering, what would you do then to try to incentivize people to get it?
Glenn, we've tried a lot of things, and I'm not sure that we're going to get a whole lot higher than we are. I mean,
Well, and I would say Harris County started out with a $3 million budget. And they had such great success with that they have now increased that to 12 million. And in conversations with a couple of with their judge and with the commissioner, one of their commissioners, they've indicated that they will continue. Now, again, they're not concerned about the fact that they're paying the folks that procrastinated. But they each, when I've talked with the different folks who are providing some incentive, they are having success at getting not the folks who are anti-vaxxers. They're not going to get it regardless. But the people who have been just sitting on the sidelines and for whatever reason haven't chosen to go out and get it, that has seemed to have been successful.
well, they went from 700% increase, so they went from 431 a day to about 3,000
a day.
A day. And how many people live down in Houston, Texas?
They still got a long way to go.
They got 4.5 million people in Harris County.
Well, and the people that I talk to who have not yet been vaccinated isn't because they're just waiting because, they don't have anything better to do but just to wait it out. There are other critical issues that they're considering. I mean, I think we forget sometimes that this is a personal health decision that some people still have mistrust and other issues, right, that are totally legitimate. So I just want to be careful how we characterize folks who perhaps have not yet come vaccinated. I'll say, because I think we probably need to proceed with the rest of our agenda or whatever's next, is I'm undecided on the incentive program. I understand that we want to move forward quickly, but that in the past has not benefited us because we lose the time in us rushing. We have made mistakes in not been able to thoroughly vet things as much as we need to. So what I'm hearing is we have more questions than we do have answers. So if we need to take a little bit more time to get more answers, then that's what we need to do, and then bring it back before us. That would be my suggestion.
I'm sorry.
Done.
All I'm just going to say, Commissioner Allen, we can surely re-agendize this if you'd like for us to.
Well, I would suggest that you re-agendize it when one of the three decides they're ready to move it forward, or to at least bring it back for discussion.
Okay.
Thank you.
We do have an audience participation form on these.
That is correct. Mr. Bucher, come on down.
Robert Bucher. To put a price on somebody to take the vaccine it's kind of disheartening and almost downright sickening. If they want to get it, they want to get it. If they're not, they're not. There's a lot more information out there that people are seeing, and they're getting more informed than prior to. When I look at the VAERS site, which is provided by the DSHS, it says 650,000 people have had adverse reactions. I'm not sure how many with deaths in there or what exactly it is, but when you put that big of a number in there, it kind of begs the question. Do we keep pushing this? Because I think we're kind of at the threshold of where people either want it or they don't. I'm not going to get it, but if somebody else wants to get it, that's fine. No problems with that, because that's your personal choice and that's your freedoms and that's your rights. But to keep pushing it past the point of just like, people are like, okay, we're done with that. If we either want to get it, we'll get it. We don't. There's some people holding off to see maybe a year or two. From what I've heard, they said, I'm going to hold off a couple of years, see what happens down the road before I consider getting it. And I think we just need to really kind of pump the brakes on that. I think the money could be better spent trying to figure out to keep climbing out of this hole that we're in, because of the COVID. And that's kind of where I want us to kind of comment on that one.
Thank you, sir.
Yes, sir.
Mr. Manius, any other briefing items?
No, Your Honor, no, not at this time.
Okay, we have more, 2 or 3 public comments. Representative Burnham, come on down.
I was going to start with good morning, but good afternoon, everybody. I'm Lon Burnham. My wife and I have been homeowners at 2103 6th Avenue for 40 years last month, so we've been paying taxes here for 40 years, and I'm increasingly concerned about how they're spent. I'm talking to you today because of a request that I've made to all of your scheduling staff on behalf of both the Lone Star Chapter of the Sierra Club and the Tarrant County Central Labor Council to have a visit with you before you actually vote on anything having to do with the proposals on the Edwards Ranch aquifer. Or not aquifer, but the ranch area out west of Tarrant County, but there's all sorts of conversations and discussions going on about what might be done when by who. I'll give it to you from an environmental standpoint. I didn't get here to Tarrant County until 1953, but since that time I've observed that the air is less than of desirable quality. In fact, we've failed air standards for over a quarter of a century. Quick aside, thank you, Commissioner Brooks, for all the things that you say about public health. The one that's been nearest and dearest to me because of my asthma has been clean air, and we've never come anywhere close to achieving that. Why is it brought up in this context? Because there are things that you can do right when you're starting out to avoid the issues that General Motors and Convair Lockheed General Dynamics have presented to us in the production process. There are things that we can avoid in advance, and this is what we want to talk to you about. Central Labor Council, probably United Auto Workers, and the Sierra Club want to talk to you about how we are growing in this community and whether or not we're doing what we can do to make sure these are good jobs, not just mediocre jobs that we're helping to subsidize in the community. With the minutes I have left, my graduate degree is in city and regional planning with a focus on economic development, regional economic development. I've been a rather strong critic of what both the city of Fort Worth and the county has done over the decades, because I think most of what we've done is to help rich people get richer as opposed to help working people be better off. So we'll visit in private conversations about this going forward, and I look forward to having that Zoom time or whatever is best suits your schedule. Thank you for your time this afternoon.
Thank you, Lon. Appreciate you being here. Next is Thomas.
Judge Whitley, commissioners, sometimes it's important to speak truth to power. There are 4 law enforcement officers in the room. Each of them, when they became law enforcement officers, swore an oath to the United States Constitution. They did not swear an oath to you, sir. A little while ago, you committed official misconduct, a misdemeanor in Texas under the Attorney General's interpretation of the Open Public Meetings Act 551.007. You may be accustomed to doing this over the years you've been the county judge, but the reality is the law changed on September 1st, 2019. You cannot influence how a citizen crafts their message, how they speak. You violated the First Amendment 2 ways: free speech, my right to redress and grievance to my government, and due process. I signed up according to the rules of the court. I stayed within 3 minutes, and you committed an offense, and I want to file a complaint with one of these officers after the meeting. Now let's get to more important stuff. The law firm that doesn't have a contract with TRWD is being paid at least $2.7 million from January through today. There is no contract. They've hired a separate firm to help clean up their act. It doesn't have a contract either. The interesting thing about the one law firm is the lead attorney's name is Pope. Now, one of their founding members, Alexander Pope, is proud to have signed the letters and articles of secession from the United States. The reason why I know that is, what bonehead law firm puts that as a brag on the front of their website? We're paying $2.7 million, and we've been paying this law firm for years to blatantly proclaim that 70% of the humans in this room are not entitled to rights under the Constitution. This is specifically what the Articles of Secession say in Texas. I am so offended by your conduct earlier, and I see the little smirk on your face, but the reality is, I checked this out ahead of time. I talked to the Attorney General's office. I talked to the head of the Open Public Meetings Division, and it is clear that you committed an offense. But back to that law firm is interwoven with staff at that organization. And if you don't think that people haven't noticed, like in your case at Whitley Penn, they name you, your image is still on the website, and they're proudly recognizing that you're a U.S. Navy veteran. That seems like a good thing for somebody to put on their website, all of your credentials. But what is Pope, Hardwick, Christie, and whatever the other Kelly the names are, the all-white law firm that we pay millions of dollars for years, who obviously don't know what they're doing in this case, they brag about the fact that one of their folks signed the letters of secession. Everyone in this room should be offended, and I do want to speak with one of the deputies about filing a charge against you.
Thank you, Thomas. Robert Bucher. He chose to waive. Is that it, Mr. Manius?
Yes, sir.
Then we will recess our open meeting and proceed to close to discuss items exempted under Section 5.
All right, so today we're doing work session 5, which this is 5A. We will be going over focus area number 4, which is strengthen the community. Again, the 4 focus areas that the court has approved that we are trying to work to develop programs out of. Today we're going to discuss allocations, expenditures, and approval process for FRF funding. We're going to receive an update from IEM, and then we're going to have some presenters from, again, for work session 5A, specifically discussing providing support to the aging population and support solutions to reduce housing insecurity. Again, the slide that we show every time regarding ARPA funds, the funds that we're going to specifically talk about today are the state and local fiscal recovery funds, what we refer to as FRF, which is the box on the left of the screen. Tarrant County received $409 million of. The court's adopted policy on how we will use these funds, again, is up there, and we will be going over the last focus area, strengthening the community. And then from our previous conversation, a report on the timeline for reporting. All reports have been submitted that are necessary. They have been on time, even though sometimes Treasury changed some of the requirements at the very last minute, which was interesting, but it was nothing that we weren't able to get through. And in the next report that we have is a quarterly report due on October 31st.
You know, I did see yesterday a presentation by one of the folks from NACO, and what they have come out and said is if, let's say, for example, you're going through and there's an interim rule, and you do something in compliance with that interim rule, and then they later in the final rules change it, they will not go back and recoup money.
Correct.
Or threaten to recoup money because you did something that was later changed in the final rule.
Yes, sir, and that's my understanding as well. It is an interim final rule. The interim is key because it was put in place through an expedited executive policy and procedure that allows for an entity to act upon that interim final rule, even though it is not the final rule. So no, that is it's where we are.
And what will eventually be the post-final final.
We will have many of these before it's over with. Yes, Judge. So again, to go back and discuss our goals and focus areas, you see on the screen, we've been expanding this slide as we've gone through this series of work sessions. We're on the last one, strengthen the community. Today we're going to be discussing, again, provide support for the aging population and then support solutions to reduce housing insecurity. And we've got several great speakers here to walk us through that. But before we get to that, we want to discuss FRF allocations, approval processes, and kind of the path forward and receive some action from the court in the form of a determination as we're kind of moving forward. All right, so you have at your place, and most of the folks in the audience have 3 different sheets. So one of them is very large. It's an 11 by 17 document that looks like this. We'll refer to this as the spreadsheet. And then there's a small one that has allocation totals. And then one that has blue on the top. Okay?
So Russell,
Yes, ma'am.
before you continue, so for this one, would this include action that we took in court earlier today or not?
So the action that you all took earlier in court today, it is at the very bottom of the document, and it would need to slide over one column, and we'll discuss the columns in just a moment, ma'am.
Okay.
So the 11.9 would slide over to the 95.
No, sir, not all of the 11.9. Okay, so this is within the federal reporting requirements, we have focus areas, and then we have goals, and then under the goals we have projects. And under projects we have programs. And so this spreadsheet is our programmatic level information. So all those different programs that we have to actually report on, and these are all the programs that we have to develop KPIs, evaluation procedures. Some that will actually require some fairly advanced logic model preparation to properly report this to the Treasury document and document to the Treasury appropriately. But everything is tied to this level. Every one of these programs has a cost center. They have a unique grant code. And again, that's every one of these line items on this particular document. So starting, you have the ARPA funding request, which this is the name of the program. The next column, the work group recommendation date. This is whenever it has gone through our work group and we have been able to substantiate and make sure that it is properly to form for the evaluation processes necessary for Treasury and meets all the requirements. Then we go over to court approval date. This is the date whenever court has made or taken action on this item on the program. First or second tranche, this is where we expect the amount of funds to come from. You'll see the majority of these are first and second tranche. If you'll remember, we received our first tranche of funding in May of this year. We'll receive the second tranche of funding, the other 50% of our 409 May of next year, May of 2022. So the vast majority of these programs aren't just going to be coming out of the first tranche, but they will cross that threshold across into having to come from potentially both tranches of funding. So the next column, these are items that have gone through our FRF work group. This is the dollar figures, and I'm happy to walk through your the spreadsheet, the 2-page spreadsheet that has the blue on the top. These are program descriptions related to the items in this column. So for every item that comes through the work group, we require a department to submit a form to Budget and Risk Management. Budget and Risk Management does an initial cursory review of that request, and then they send it to the administrator's office, where we begin an evaluation process. We call it a checklist of actually going through and substantiating, beginning to find where it is an interim final rule, any of the Treasury FAQs, and it's an extensive multi-week process of actually making sure these programs fit and have the proper justifications to move forward. So whenever it gets to the work group, we work through and discuss on these various issues. So the ones before court that work group has recommended, but we have not brought to court individually, but we would like to get it moved from this column over to the next column. So you've got $120,000 for additional space for the Tarrant County Medical Examiner. This is for cold storage due to COVID-19. $1 million. This is for facilities cleaning with the coronavirus relief funds, the CRF funding that Commissioners Court received $200 million of. We funded a number of programs that are ongoing. One of those is an enhanced cleaning contract that we have with our current facilities vendor to do enhanced cleaning at various issues related to that. This is to extend that program over and bring it over into ARPA. So this is currently funded out of CRF, but we're transferring it over to ARPA. $65,000 related to the medical examiner needing a vital statistics coordinator. This is action that you all took in court today. So this one would move over. The CCCA competency coordinator, again, this one would also move over because that's items that, as well as DRO. The child custody visitation staffing, that 179, as well as the IT below it, the 367. Now, $50,000 has been recommended for the Commissioner's Court AV room consultant. This is to begin the process of changing over the audiovisual capabilities of the Commissioner's courtroom and updating it to be more accessible to the outside public due to COVID-19 and wanting to lessen and mitigate any COVID exposure.
Yay. Long overdue.
Well, and I agree, but again, this could be one of those where, yeah, we can spend ARPA money on that. We need to do it regardless.
Yeah.
And so those are the kind of things that I at least want us to think about as we go through this and maybe sometimes not be too quick. I mean, I would say the same thing with regards to the, one of the other things. Visitation. You know, there's some of those other things where, again, it would be good business to do it whether we did it whether we had COVID or not. And, maybe at the last minute we spend that money for something along that type of lines. But I think there's going to be a lot of opportunities. We've heard some in the last couple of weeks. We'll hear others. And, I think we're very financially sound. That doesn't mean we just go out and spend money to spend money. But at the same time, I think we're going to, these are the kind of things I want to just sometimes question as we go through that. As we get over to the next column, I might
and then
have some other items.
The $81,000 for the CCL staff, it's floating court coordinators. County Court of Laws number 1, 2, and 3 need an additional staff member to deal with the increase of cases that they're seeing directly related to to the effects of COVID-19. And then at the bottom, you'll see 5 items. These are larger items. One of them, the CDA's Community Violence Intervention Program, can slide over since court took action on that one today. But
Russell.
Yes, sir.
Concerning that, I have been the one who has pushed having a violence intervention program as a part of this activity. I hope that this is going to be truly a prevention and intervention program and not a prosecution program. I question whether the district attorney's office is the proper place to house this program, because you will not get traction in the community with those who need to be part of a prevention and intervention program if it's a part of the district attorney's office.
Understood, Commissioner. So will be part of a larger so this is, as I was explaining earlier, this is at the programmatic level. We've got all these programs that wrap up under projects. So a project that we have to report to the Treasury on is specifically related to community violence intervention programs. So this is one of what we're expecting to be several programs that will run under that project. So the positions that were approved today in court do have a prosecutorial, some of them do have prosecutorial areas that they're working with, gang, specifically another prosecutor under the gang section, because we have seen these criminal district attorney's office was able to demonstrate COVID-related increases in various areas, but this also includes protective orders, another protective order attorney, a CPS attorney, and others that were trying to deal with some of those other issues within the community that would roll up underneath that.
And I think, though, what Commissioner Brooks is saying is that while the positions that we have funded in the DA's office today were okay, he wants to see the program expanded as relates to violence intervention, and that program needs to reside outside of the DA's office. That's all he's saying.
Understood.
Precisely.
And I would say that under this category, you and I talked about this a little bit earlier, there are certain things which we may be able to get reimbursed for, either through FEMA or through some other agency.
Mm-hmm.
And I'd like for us to have some sort of a column out there, for example, the PPE. I'd like for there to be a column out there that says, we believe, at least at this time, that it can be something that is recoverable.
Okay.
Yeah, I would think
absolutely.
I think that spreadsheet would look somewhat like what we've shown you in the past, but probably more detailed. And that included exactly what you're saying, Judge, as far as different funding sources, funding streams.
And for those specifically, the $4 million for the testing related expenditures that court approved a couple weeks ago, I believe it was, the $2 million for vaccinations, and the PPE program, those three are very good candidates for other potential sources of funding as we are moving forward. With FEMA extending their deadline for submission for COVID-related expenses to December 31st, that's definitely an option. And then there's $500,000 related to providing a safe environment at the Tarrant County Jail. We have funded through CRF a number of projects or a number of items that have come up specifically related to providing COVID-mitigated congregate settings, which is specifically allowed by the IFR. And so with that, this could be anything for purchasing styrofoam trays to additional cleaning solvents and whatnot in order to try to provide that safe COVID-19 mitigated environment in the county jail. This is, again, we have to look at this programmatically. We can't just enter recs for this. So this is a bucket of funds, a program with a bucket of funds that we will be able to categorize those expenditures to as they do come forward, specifically related to that. And then $600,000 for the Mercantile 1. This is for a public health facility lease. In the Mercantile Center, there's Mercantile 1 and Mercantile 2. This is for the Mercantile 1 FY22 lease cost of that we're expecting around $600,000. That is previously funded out of CRF. This would roll over to FRF funding. So with these recommendations, one of the items that we're trying to do is trying to get all the CRF funded items slid over to this new program so that we can finally close out the CRF funding. So that's part of what we're trying to do. But with that, and then the next column is direction received by Commissioners Court. We can discuss any of those items that you all would like to discuss, but these are items that we have come before Commissioners Court and we have received direction on these particular items. And then the next column, contract PO or salary approved. This is the column where we can tie the expenditures to a court order or a specific action by the court, whether it's authorization of positions or whatnot. And on that one, the total is $18 million that you all have approved so far. And then if you look at, and then finally the amount of funds expended, this is money that is out the door, you're at $94,000. And then if you look at the one-page document that looks like this, the same kind of color scheme, this has your focus area totals. For focus area 1 and 2, we'll be adding to focus area 4 since community violence intervention will go, those programs go in focus area 4. But if you look at those totals, the FA by approval, and that's again approved through a court order that we can tie back to specific court actions, Focus Area 1, you're at $6.1 million. Focus Area 2, you're at $11.8 million. And so the programs that the court is authorizing, you are pushing out funds into the community and making those necessary services available for them and expediting them as quickly as we all can move it out in that way. So
And again, when I look at that column next door on the left, other items that I feel like at least I would like to have some discussion about whether or not we want to use FRF money or other, I would say, facility mitigation capital, Tim Curry elevator. Air quality improvement. Those are the ones that pop right out.
So you're saying to use general funds?
Well, I'm not saying for sure, but I'm saying let's have a discussion, or at least potentially highlight those areas as ones that we may or may not want to use as we get more into the priorities and we look at those things. Because if our consultant comes back and says, here are the priorities, and these priorities we think is going to be X amount, if we don't have that left, then I might say, okay, as opposed to spending $14 million from FRF on the Tim Curry elevator, I'd rather that be pulled out of our other capital or.
And what we see here is initial processes. And I think now that you've seen that, we'd like for y'all to take a look at it. If you want to have further discussions, we will always have this agendized for y'all to do that in the next Commissioners Court meetings.
All right.
Okay. All right, let's get going. All right.
Thank
with
you,
that,
Russell.
thank you.
with that, we're going to go ahead and ask Ms. Camarano to come forward and begin the.
IAM is the next item on the agenda. So, Katie.
So, Katie, I guess you're up.
Hi, good afternoon.
Hi, Katie. How are you?
Hi, Katie.
Thanks for having us back. So we wanted to give you a quick update on the needs assessment, resource assessment. There we go. Can you hear me okay? Okay. As we start to wrap up phase one, where we started looking at what the recovery needs were, what our objectives were going to be, and then what resources were available, we're going to bring you all, of course, the interim report that we've been talking about by the end of the month. But then we'll also bring you an action plan for those immediate needs that we've discussed. So that'll move us into phase two with those near-term implementation and the long-term prioritization. So the second track on that is going to be those long-term prioritization items, where we will start looking about how to prioritize those objectives, those projects, and do so in an equitable and fair manner. So when we move into phase two, we'll be doing a series of roundtables, a series of workshops, and not just including the SMEs who will be building the strategies, but also including representation from the communities who actually need access the most or the support the most. So using that community alignment to make sure that the strategies that are being presented align with what the community actually needs and will support them being able to access that. In phase three, when we talk about strategies and recommendations, that'll be that final report, as well as the list of prioritizations, where we'll be focusing our recommendations in some specific neighborhoods, and I'll show you a map here in a few minutes. So as we wrap up phase one, we've done a series of work sessions, some key stakeholder group meetings, a significant amount of interviews. We've also done some resource review on our end, GIS data analysis, some demographics analysis, and then that research and review of community partner needs assessments that have already been completed. So you'll see on the screen on the right-hand side, those are all the interviews that we've conducted up until last Friday. We actually did 2 within the last 24 hours, and then we have 4 more left for the rest of the week. And then we've also done a number of work sessions and briefings. I'd like to thank Commissioner Allen for inviting us to speak to the quarterly Latino Leaders Group. Their input was extremely valuable for us, and we'd like to continue to build those relationships with any other community groups that you have as well. What you'll see here is also our key themes that have come out of all of these conversations. So in every conversation we've had, or for the majority of them, we've heard the themes of mental health, food and housing insecurity, and then workforce development, but also the support services for the workforce. And when we talk about these things, we're also looking at it from a lens of equity, where it's not just about it's missing, but also how do people access it. When you're looking at support services for the workforce, we've heard things about childcare, transportation, and fair wages or livable wages. So that's something else that we're keeping in mind as well. Our resource assessment, this is just a snapshot of what it looks like. So we're building an outline of what those FRF specific programs are, the agencies that are supplying those, the purpose, focus area, and description of them, as well as who's going to be eligible to apply for them, and the application award deadlines. And then a little bit more on the equity lens. So this is an overlay of, in the red, you'll see the CDC social vulnerability indices. In the blue, you'll see the Census Bureau's community resilience estimates. And then the yellow piece of that is going to be the overlay of both of those. So when we talk about equitable access, we're going to be focusing in those yellow areas for our recommendations. So just to recap, we're moving into phase 2 in the next few weeks. If you have additional individuals you would like to see us include in focus groups, we'll make that request to the court to please supply those names for us. But then we'll move into phase 2, and then we'll have phase 3 complete by the end of January. And that is all I had today.
So what kind of report, you're going to have a preliminary report to us by the end of this month?
Yes, sir.
You're asking for more names of groups to visit with. I provided you with names of groups that I didn't see on the list of people with whom you've already visited.
So we had done an initial outreach for the individual groups that had been designated as ones and twos, and then some of those names were designated specifically for focus groups. Specifically, the community-based organizations and the faith-based organizations are going to be included as part of those focus groups and roundtables. And that community alignment that I talked about, that's really where we want to pull them in to make sure that we're building strategies that fit the needs of the communities that we're serving.
One of the categories of organizations that is missing specifically from your list is arts organizations. I provided several of those, and I don't see where they fit into your schema anywhere.
I believe we're going to do a focus group focused on the Arts Council, but then also some of the organizations that you provided as well. We have a couple of names and phone numbers for different groups within the county that we'll pull together to talk about the arts.
Thank you.
Of course. Any other questions? Okay, thank you very much.
Good afternoon. Hi, Kristen. Okay, so I'll just very quickly reiterate the goals under this focus area. To provide support to the aging population, support solutions to reduce housing insecurity, both of which we'll focus on today, mitigate the impact of community violence, alleviate food insecurity, and enhance access to youth services. The latter three will be discussed in work session 5B on September 28th. And so first, I'm going to introduce two groups to you. One, Area Agency on Aging, and their new director, Shakita Johnson, is here with us today to present to you. Following Shakita will be Becky Orender with 60 and Better, and she has brought with her Chandra Thompson and Rebecca Malden, who will be available to answer questions along with Becky. So I'll go ahead and invite Shakita to come up.
Welcome.
Thank you. Thank you very much. Thank you for allowing
us and inviting us to present to this distinguished body. It is an honor, and it is our second opportunity to be here, so thank you very much. As previously stated, my name is Shakita Johnson. I am the Executive Director of the Area Agency on Aging in Tarrant County, and I also serve as the Vice President of Community Investment for the United Way, Tarrant County. Can everyone hear me? Okay?
Yes.
Okay, great. All right. Now, our mission at the United Way, and I'm going to give you just a brief overview of our organization, our observations that we observed during the pandemic and the ongoing pandemic, and then our recommendations for recovery. Our organization's mission is to provide vital services to seniors and their caregivers. We are commonly referred to as the AAA, not to be confused with providing roadside assistance, because we do not do that. The AAA, there are 600 AAAs across the nation. There are 28 in the state of Texas, and what makes the AAA in Tarrant County unique is that we are one of two that are actually embedded and a part of the United Way system. So that really puts us in a unique opportunity to combine our resources and our infrastructure to expand our reach. Now, in addition to serving Tarrant County, our organization also supports other AAAs, which allows us to touch and impact 14 surrounding communities here in the North Texas area, and those communities are listed on the slide. There's also a note there that the AAAs are funded in part by the Texas Health and Human Services statewide and then federally through the Older Americans Act. And one thing that was fantastic is that you see there that we received about $10 million in federal and state funding. A good chunk of that was due to CARES Act funding, which will be expiring soon. But with that increased resource and those increased dollars, the demand for services are just far outpacing the resources. And so I just want to give you a little indication as to what we saw and how we came across this information. Our organization serves seniors directly, and then we also partner and collaborate to provide indirect services. So the services that we provide directly are listed above. The service navigators and the cognitive health team, those are individuals that work with seniors to meet their tangible and non-tangible care-related needs. Our benefits counselors during the pandemic, even before the pandemic, but surely during the pandemic, provided guidance to our local seniors regarding their medical insurance options such as Medicare, Medicaid, managed care. They are trained and certified by the state of Texas to provide that information and provide legal awareness regarding advanced care planning. And then we have the long-term care ombudsman program, which are tasked by the state of Texas to visit all 200 plus nursing facilities and assisted living facilities in Tarrant County. And not only do they visit, but they report and provide monitoring that goes directly to the Texas Health and Human Services Commission. And then lastly, we also run the Aging and Disability Resource Center, which is, if you think of 211 or a call center, largely in that function, but I told them I would never refer to them as a call center because they do so much more. They provide navigation, housing counseling, veterans options, and a variety of other things. All right, and this is just a list of services that we provide in coordination with other partner agencies. Some are, we don't just work with other nonprofits, we don't just work with assisted livings, or other AAAs, but we also work with private businesses to provide things such as residential repair, transportation services, and a variety of others. And that's just a snapshot. So in 2020, according to the census data, the 65 and older population here in Tarrant County comprised of 12% of the overall population. And so this population not only is significant, but it is expected to grow by 25% in the next 5 years. And so while we're in a wave, we have another wave, another surge of seniors and retirees that are looking to us to meet their needs and be a place where they can live in health. And a note there, in 2020, our organization served directly and through our partnerships upwards of 40,000 seniors. And so we had a pretty good view of the needs that are listed here. So on this slide, the onset of COVID in 2020 combined with the catastrophic weather events that we experienced this year really did expose the fragility of our social service systems. And while the items on this list are not new, they were definitely exacerbated during the COVID pandemic and the ongoing pandemic. So rural isolation, lack of transportation, increased food insecurity, staff shortages in healthcare was significant, and a lack of non-acute post-acute housing during COVID-19. So our recommendations for recovery. One, we would encourage our community, if we're going to be responsive and take a note of the social determinants of health, which are those things that impact the health, risk, and outcomes of our seniors. If we're going to be responsive, one thing that we would like to recommend is that we address social isolation, address the increase in social isolation due to COVID-19. And one of the solutions that we propose is creating culturally competent outreach strategies for more effective engagement. Now, that's a mouthful, and that really just boils down to being able to provide services to individuals in a way that they can understand, whether it be language, whether it be culture and heritage, and whether it be location. Being able to provide home services is significant in this ongoing period of quarantine and separation. Our next recommendation for recovery is to focus on healthy aging. The AAA really is seeking to reach and expand evidence-based programming to help individuals be informed about disease prevention, but also be informed about how to manage those diseases so that they can remain independent and out of healthcare settings longer. And so one of the things that we're proposing in going forward, and as we look going forward into even within our organization, is taking note of some of these activities that are listed here. These are programs that we provide already, diabetes screening and management, and we provide it directly and indirectly and in coordination with some of our organizations, even the one that will be presenting after me. We work with them to provide these types of services. So an expansion of those programs to improve healthy aging is one recommendation. And then this chart is a slide, just a sample of the grant-funded programs that we implemented in 2020. Some are ongoing, some are expiring, but this is just an example of the type of collaborative sources and resources that are out there to address some of these needs: fall prevention, healthy aging, and at the very bottom, the program to encourage active, rewarding lives. The Dallas Pearls program is a focus to reduce social isolation. Third recommendation would be to reduce food insecurity. And one solution and one way to do that would be to increase the congregate and home delivered meals that are offered through the food and nutrition programs in Tarrant County. Most commonly, I won't take for granted that everyone's aware. But Meals on Wheels here in Tarrant County is one large entity that is doing a lot of that work, but there are other areas and other agencies that are doing that type of work as well as listed there, the Tarrant Area Food Bank and school districts. And then my last recommendation, our last recommendation is to increase the transportation options. One thing that we do know that the county has made available access to Lyft and Uber and Uber Health for COVID-related appointments and things of that nature. However, there still remains a need for continued transportation services for non-COVID related appointments, grocery shopping, just a variety of things where seniors are having a challenge. And these transportation options also become a challenge in the rural areas as well. And then I do have a note there that states that, Lyft, Uber, those are all smartphone application-based programs. And so to make it available on a county-wide or a city-wide basis would require some level of negotiation on higher level negotiation with those companies because they are private entities. So I just want to make sure that we definitely recognize that there are some barriers and challenges there. And then exploring the opportunity to create other ride-sharing programs. All right. And in conclusion, I just want to state that the Tarrant County United Way and the Area Agency on Aging, we're uniquely equipped to make those observations and to make those recommendations. And we are looking forward to implementing new and expanding existing programs. Thank you.
Thank you.
Thank you.
One of the things that you brought up was transportation, and the North Central Texas Council of Governments through the RTC just did a transit study that they just finished. And primarily a lot of it focused on seniors and transportation for them. So we might, dig into that and see what we can come up with that might be something that works. And so.
Absolutely. Thank you.
Yeah.
Thank you.
Good afternoon.
Hi, Becky.
Thank you so much for letting us come speak with you today. I'm Becky Ornder. I am Executive Director at 60 and Better, and like Shakita, we both are kind of short term with older adults. I was with Arlington Life Shelter for 20 years and worked with many of you in that capacity. And joining me today are Chandra Thompson. She came with me from Arlington Life Shelter. We both started about 4 or 5 months ago. And we work greatly with older adults in that capacity, very much in Arlington 76010, 11 zip codes. And at that point in time, older adults was the fastest growing population. So a lot of experience in that area. Rebecca Malden, she's one of our, Dr. Rebecca Malden, I'm sorry. They're both here to help answer questions. She is an assistant professor at UTA in the School of Social Work, Gerontology. So if you have any specific questions, she would be more than happy to visit with you on those. 60 and Better has had a lot of changes in the past year, and not just because of the pandemic and the impact on older adults. Our mission is to help older adults live with purpose, independence, and dignity. Thank you. And we do this through helping older adults and their families remain healthy, active, and engaged. And since 1967, the years of Carlton Lancaster, if you remember him, you do, Judge.
Oh, yeah.
60 and Better has been providing food service and social activities at senior centers, up to 43 at a time throughout Tarrant County. And then the pandemic hit and closed all the senior centers. And up through the pandemic, I guess the centers were closed in March. And up through September, I believe it is, we went out and provided services, provided delivery of food, follow-up phone calls, that type of thing to make sure all basic needs were met. But at that point in time, last September, who knows what's going to happen with the pandemic? 90% of the organization's resources were management of senior centers. So with help from AAA, at that time, the organization permanently transitioned all of the food services from 60 and better to Meals on Wheels. And they're working with those now. They're continuing as the centers reopen. Very difficult decision, I think, for both organizations, really, because that took Meals on Wheels a little bit out of their normal, purpose. But it's been very good for, I think, the center, directors, the city, whoever owns the facilities, because the way it was set up, pretty much the people, processes, everything that 60 and Better has had for years were pretty much just picked up and taken over to Meals on Wheels. So people coming to the centers, they're seeing the same people. They're working with the same people, the same systems. They're seeing a different color T-shirt. That's the main thing. So a lot of change for 60 and Better. I was brought in March. And at that point in time, the organization had done a whole lot of work on what are the needs of older adults. And a lot of studies have been done in the past, but a lot of the information was pre-pandemic, and so much has changed since then. So the board has been looking very closely at what are we going to do? This is one of the senior centers. In addition to managing the senior centers, we are continuing to provide the evidence-based classes like Shakita was talking about. Okay, what we're doing now, as we've been out visiting with people about what are the needs of older adults, we found that shorter classes are needed. The evidence-based classes, those are very important, but what we're finding in talking with people is that we have to shorten the classes to better address the decreased mobility and attention spans of the participants. Judge, you're kind of smiling like that's all of us today.
That's right.
So the classes are more interactive and really addressing a lot the balance, the mobility, and increasing endurance, especially at the care facilities. People have been locked in their rooms and now they're coming out and about. We had trainers go over to Hill Villa over at LVT Rise area, and they were over there to teach a Tai Chi class. And I didn't know much about Tai Chi, but they kind of explained that, and I may be off here, there's a lot of core movements like helping you strengthen your core, and that's what they had said they needed. That's what we knew pre-COVID they needed. Our instructor went over and everybody was on a walker. She's like, okay, how am I going to help them with core strength with everybody on a walker? And it just really showed the number of changes that were going to be needed. One of the new programs that we're able to launch a little bit later this fall is called Walk with a Doc. And we've done it some in Tarrant County. It's real big in San Antonio. And it's being sponsored by WellMed and USMD? Uh-huh. And it's a wonderful program where you have a health practitioner, usually a doctor, from the specific neighborhood. So working with WellMed, they have certain clinics, different places. So it would be a doctor from that area who would meet with people in a city park. We're looking lower income areas, really those that are targeted for challenges with older adults. They visit and then they go on a walk together. And that gives the participants, the Tarrant County residents, a chance to visit one-on-one about issues, to develop a relationship with a practitioner. We have been promised their specialty program, and hopefully you'll think this is funny. They have a rooster club just for men, no women allowed, and they talk about men's issues. And they have their own T-shirts that say that they're members of the rooster club. Is that kind of cute? I really like that. I thought, no, that's pretty cool. So that's what we're doing now, in addition to some of the things listed there. And all of this, is happening because the organization's working so hard looking at what is our core going to be. Because for 50 plus years, we did one thing, and we did it very well. So looking at what do we do well, how do we transition that and help the county, help older adults. And the sustainable community development model, I know you've heard community development said over and over again, is really what we're focusing on. Not how do we provide other services, but instead looking at how are the services being provided. Recognizing, like the folks were saying earlier, we've got good services, but they're not getting to people. And if they're not getting to people, they're not able to engage, but also they're not being presented in a way that is acknowledging the differences in our communities. And so they're not being well received. The other piece that we're going to be starting in 2022, if y'all know the name Evelyn Siegel, she is the founder with Roz Rosenthal.
Oh yeah, those two.
You know her?
Get them apart.
Yes. Evelyn's 96 now. So we are developing an intergenerational arts program for grandparents and grandchildren because we've heard over and over again from our faith communities that is the relationship that was so greatly impacted during the pandemic, especially in the early months. The relationship was tight, and then all of a sudden young children can't hug grandma, can't see them, don't get to enjoy those wonderful meals. So that is our real focus, and really looking, not come together and let's do crafts, but really looking at it from a way that can honor the founders, that can honor Evelyn as a longtime teacher at Country Day School in the arts program. We're looking at the arts, visual, music, drama, and dance, and we're using these as a tool to connect. This might be looking at art, the art form of, what are those flip books, years and years ago that had the pictures and it was a movie. You flipped through it and you saw all it, So starting there, developing a flip book, going all the way through the grandchild making a video on their smartphone with their grandparents. Really looking at how they can learn from each other. So we're looking at something that really is going to address the arts and get them involved with our existing resources in the community, but learn appreciation for each other. Okay. I was asked to define the needs that we're seeing. I'm reporting from what we're hearing from former center participants, caregivers, elders of faith communities throughout Tarrant County, and directors at independent and long-term care facilities. Number one, besides transportation, that always has to rank up at the top, decline in overall health, balance, and mobility. And as we know, that impacts everything about someone's life. Increased symptoms associated with chronic diseases, diabetes in particular, isolation, depression, and associated cognitive decline. And that was the cognitive decline was an area that the members themselves, the older people themselves, identified as their greatest concern. And then home safety concerns, that they haven't had their homes maintained. Plumbing is broken. They have appliances that don't work, that type of thing. 60 and Better's plan.
Let me just stop. From that standpoint, as far as the homes and things along that lines, I know that there are several communities now, several towns. Six Stones began the program.
Yes.
That really goes out. Are we finding a way to link these needs to folks like Six Stones? I know North Richland Hills. Several of the other communities have begun to pick this up. Are we linking them together?
Do you want to finish my presentation?
Good.
You led right into exactly what I was going to say. 60 and Better is looking at community development, like what I just said a minute ago. Looking at not how do we develop more programs, but how do we make them accessible? how do we make them accessible for the long haul? And that's what 60 and Better does well. That's what Mid-Cities Care Corps does. They don't just start a program and stop it. And that seems to be a huge concern, that there's so many things that we get money for and we go out and we start and get people engaged and then the money runs out. And both of those organizations, I think, do a great job at staying engaged. So like I said, our big thing is not necessarily looking at what services are we going to do. You know, we really focused on, we're providing services through the centers. Now what we're looking at is how do we expand beyond the center walls to really address the communities. We have trust. We've been there forever. We know the community leaders. How do we then look at people's lives beyond those 6 hours they're at the centers? And how do we engage them in services that are already out there? They're hard to serve areas. You've got to have trust to get folks out. Community development. I just love that slide. I'm sorry. I just thought that was perfect. Empowering community members to define their own needs, develop solutions, and be active participants. We're wanting to focus on this specifically because we have so many programs that are cookie cutter programs. And we take them out to a community. People don't show up for the classes. People don't show up for things because they're tailored like it's the same program for people in downtown Fort Worth, that type of thing. So really, 76014, 76119, those needs are completely different than, North Arlington, Central Fort Worth. So, let me get back to my notes. I'm sorry, I'm going over, I'm sure. 60 and Better, we've selected this because it's what we do best. We pull communities together. We have pulled so many people into the centers, the faith communities, really engaged people. And so this is just kind of the next step to make it to involve the community. So social isolation keeps being discussed, and it's long been a concern. I think the pandemic only amplified the need. Like I said, 60 and Better's plan is to work beyond the walls of the senior centers, engaging the seniors in their communities, letting them define what they need, rather than us going in and kind of looking. We want to look at an asset perspective. We often look in a lot of communities at the deficit. What don't they have? Really looking at how can we work with them to build on their strengths. So our anticipated project components, and I'm saying anticipated because this is a work in progress. The board is at the stage now where they're looking at it in committees, final committees, to make sure it's sustainable. Our last program lasted 50 years. This is something that we want to be able to embrace fully, financially support. Can we get community participation? Can we get support of the nonprofit organizations? I mean, there are a lot of challenges that are involved with this. So our primary components would be working with community members to identify and prioritize their needs and solutions, and then engaging them in what we're doing. Development of ownership. And that's essential. That's what we did so well in the centers, I think. There was a council that planned all the activities, that planned things specifically to meet their needs. When do we do a health clinic? They would tell us. Using underutilized resources in the community, identifying that lower income communities have strengths. And I think a lot of times we forget that. And then increasing the cultural competence in service content and delivery. We heard over and over again in talking to people that when you go in and do a class or you go in and do a program, putting an African American person in front of an African American audience, that's nice, but it can't end there. And I think we heard that a lot about the fit between programming. What we're looking at doing is looking at select zip codes, hopefully one in Fort Worth, one in Arlington. We've already identified 014 as one we'd like to work with. And working with the communities for 12 to 18 months, being in the community, in the zip code, 12 to 18 months, working with community to develop systems before moving to the next community. At that point in time, before we move on, we're going to make sure the community is stabilized with the needs they have, continue to provide technical assistance as needed, and then hire people from within the community if there are parts that need to be sustained. Because right now, it just seems like we really are, there's so many holes where we're not getting to the people who need us most. This would give us a chance. We're not going to be all over the community. You know, we will with our classes, but we're going to focus on making a change in some of these zip codes, changes in systems, because us baby boomers are starting to get old and we need services. You know, we need to have those services in place for the long term. We're on, you know, our population group of older people is going to continue to grow. So on that, I have to add one thing because I promised Texas Health Resources I would. We're working very closely with them on immunizations and flu shots because they're having a great deal of difficulty getting in to communities, and we've got a lot of inroads with our faith communities. And community development, Rebecca pointed this out to me, it's all about assessing needs, but that's one we're stepping forward with as an organization, saying that has to be part of each plan, because that's something that we just hear repeatedly. Closing thoughts, I want to make a request as the longtime director of a smaller nonprofit organization. If the county could consider providing support to smaller organizations, grassroots organizations, in applying for these funds, future funds, because these are the groups that really are out in the communities. They're doing the heavy lifting, but they don't necessarily have the expertise to write grants. So over and over again, money goes to the larger organizations because the costs can be lower, but as soon as the money runs out, so often they're gone. And it's the smaller organizations that continue on. So if part of the funds, I have no idea how things are set up, but can a contract be set up with the Center for Community, C&M Connect, Center for Nonprofit Management, to help these nonprofits either write the grants or manage the grants? Because if you have a small organization like Arlington Charities, I mean, they have, 4 or 5 staff members, but they do incredible work. So that's my parting plea to you. So I brought my associates with me. If you have any questions specifically about what we're doing or what the everyday person says.
Yeah, thank you, Becky, for what you presented. I do have a question about the senior centers and how many would you estimate have reopened? And the reason why I asked is, one, you brought them up, but then also I was meeting with the new mayor of Kennedale recently, and the Kennedale Senior Center was just reopening for the first time during COVID last week. So if you could give just a rough approximation of about how many of the centers are actually open, whether it's full scale or not.
In talking with Marcus, who was with us and is now over at Meals on Wheels, there were about 12 to 14. The challenge is one opens and then somebody tests positive and it closes again. And they have the challenge of the food delivery and is the numbers. I mean, some centers, Forest Park, from what I understand, the last time they opened, they had 4 to 6 people. So you look at the cost effectiveness of providing the services. Chandra this morning went over to Diamond Hill to do bingo size, and they closed because somebody had COVID.
Yeah.
So it's just that process, just like the schools, I think. And so they shut down. But right now, 12 to 14.
Wow.
And it seems to be the bigger ones.
Yeah. Okay, thank you.
That are open. Mm-hmm.
It was the same question I was going to ask. So. Great minds think alike.
What can I say? Can I ask you to ask Rebecca a question since she spent her whole afternoon with us and she's a professor at UTA?
Yeah, go Mavs. Please, is there anything you'd like to share with us? Oh, you'll have to come up here.
No, you got to come up here.
Yeah.
I know you can hear me through this mask because I teach with a voice amplifier, and you can be heard through the mask.
But for those who are watching remotely or for the recording, we couldn't hear with you back there. No, you don't have to take it off. We just couldn't hear you. We needed from the recording.
No worries. Anyway, hi. Thank you for giving me an opportunity to speak. I just want to sort of speak from the heart that COVID, I know you guys know this, but COVID hit older adults so hard. They carried a big burden, not only with hospitalizations and death, but just the social isolation and the inability to connect with one another. So when you see organizations like AAA and like 60 and Better that are coming in and really looking at helping older adults reconnect in the communities and connect with one another, find ways to combat social isolation, but also give people a sense of worth and value, because in COVID there was a lot of ageism, a lot of discussion around, my dad called me up once, he's 83. He said, I just found out that if I get COVID, I'm like down on the list of people to get care. And this man is a man who's engaged in his community on a lot of boards, walks 5 miles a day, and yet just because of a number of how old he was being excluded from social participation and from what in his eyes were full access to the healthcare system. So I'm so happy to see these funds available, and I'm so happy to see consideration being given to organizations that are really helping empower older adults. So thank you very much.
Thank you. Thanks for coming out tonight.
Okay, thank you to our speakers so far. I'm actually going to headline the next section. I won't talk too long, I promise. But I do want to talk about our ERAP program. I think that as we start to talk about reducing or supporting programs that reduce housing insecurity, giving you an update on the emergency rental assistance program that the county has been running since March, it's a good time for that.
So Kristen, before you dive into that, there was an issue that came up last week during court about the state and then payments and all of that. Where are we on that process?
That was resolved on last Wednesday, so the state sent their file and the auditor's office was able to quickly check it and release payments.
Okay. You actually told me that now that you said it. Yeah, we did talk about that. Okay,
Yes,
very good.
yes.
Thank you.
Sure. Okay, so I'll provide, again, a quick overview of where we are right now with our emergency rental assistance update and our program and kind of what the next steps are for that program. Just a reminder of how we're funding it. The first round of ERA funding came through the Consolidated Appropriations Act, that long forgotten act that happened at the end of 2020. We received $24 million through that piece of legislation, and then another 26 through ARPA. We've received 40 of the 26 million, and we'll receive the remainder in May. And I'm going to go through these pretty quickly, so stop me if anything is of particular interest. Here's call center volume. Average weekly calls, 458. Median weekly calls, I throw that in there because there's an obvious outlier, 417. Folks aren't holding very long before a call is answered. Average is 23 seconds, and each average call is about 3 minutes long. And you'll remember we set up a tool, GetRentAndHelp.com, when we launched our ERAP program. So here's an update on the demographics of who's coming through that and who we are referring out to. So aside from referrals into our program, we're also providing referrals out to the cities of Grand Prairie, Fort Worth, and Arlington, the Homeless Coalition, and other community programs. There's a small pie chart in the corner that shows you that 76% of all applicants are coming through on their mobile phones. So that gives you some idea of how people are accessing services right now. These are the reasons given for why individuals and households are applying for assistance. Just under 50% have either been laid off, their work hours have been reduced, or they need to care for a dependent. And the others are listed there in order. And these are locations where our applicants live. So you'll see a large concentration in the Northeast, some in the East, and then kind of scatters throughout the rest of the county there. This is who's applying. You see the race and ethnicity breakdowns in the pie charts. The average age of our applicants is 40. About 31% are male, 68% female, and just under 1% non-binary. Some additional demographics of our applicants. You may be surprised to see that about a third of the applicants are a single household, one person in the household. Almost 50% of our applicants are under the 30% area median income, and that's based on 2020 income or their last 3 months of income.
Kristen, is this pretty on trend from the last report you did a few months ago?
It is. We've seen a larger percentage of single-family households in recent months than we did in the beginning, and we have seen slightly higher incomes than we did the first time I gave this report, and I can kind of run some comparisons and provide that to you at a later date, but to give you an idea of how things may have changed. And so as of today, Tarrant County has provided for a little over $4.5 million to 592 unique households. The average assistance per household is about $7,600. That has gone up as our average length of assistance has been extended due to Treasury guidelines.
What is that average length now? Is it, currently our policy is up to 18 months?
Yes. Yes, it is. Up to 18 months. So before I show you the next slide, I just want to tell you that $4.5 million seems like not a whole lot. We've talked quite extensively in the courtroom and in individual conversations about the state and their program. And so I think it's important to provide you with an overall look at the emergency rental assistance being provided to Tarrant County through Treasury funding, through ERA funding. So you see on the left there, here are local ERA programs. Tarrant County with $4.5 million. The City of Fort Worth provided an $11 million estimate. City of Arlington most recently reported $1.5 million dispersed for a total of $17 million. Texas Rent Relief, which is the state's program that ramped up after an early, very slow start, has now provided over $88 million in emergency rental assistance to Tarrant County. So we talk about our numbers in court every week, and you see $2 million, $3 million, $4 million. But the big picture is that over $100 million in rental assistance has been provided to Tarrant County renters. And those are numbers that you're not going to see cumulatively listed in newspaper articles. But I think it's important to understand
You'll
that number.
hear the allocation, but not actually what's been used, right?
That's right. Or we'll hear just the local program numbers and not necessarily the money received from the state program. Yeah. So that's So next steps for our program, Treasury continues to release additional FAQs and guidelines, and our office and the Housing and Community Development offices and the Auditor's Office work closely and monitor those guidelines to see, what other programs we can be standing up or what other uses of the ERA funds there may be. I've recently had a couple of conversations with Tarrant County Homeless Coalition and Lauren King, who's with us today and will be presenting after I do, about some of the programs that she's seen other entities roll out using ERA funds, and so we're exploring those. We're working with our internal departments to identify any existing programs that we might be able to subsidize or supplement with ERA funds as they continue to expand the eligible uses. So there's still a lot to learn and to understand, but we'll bring those to court as we understand and develop recommendations. We are working on an agreement with Legal Aid of Northwest Texas. This has been in the works for a few months. So we finally received an agreement back from them and hope to bring that to you in the next couple of weeks. That will be funded through ERA and will provide legal aid fees and court fees and attorney fees to eligible households who are facing eviction. And then one other thing to put on your radar is a federal bill that's been proposed and will be reviewed by the House Financial Services Committee this week and next. And it contains some additional provisions that will make it even easier for local governments to distribute ERA funding. And I'll let you read those there. But again, we'll be working and coordinating with the Auditor's Office and other departments as we learn more about this. I will say that there's the message we're receiving over and over from the federal government is we're trying to make this easier. We're encouraging you to use as many self-attestation provisions as you can. So we're gearing that direction. Before I leave, I'm going to mention one other program. We've talked with all of our internal departments about programs that they're currently running that might be able to be enhanced or expanded through FRF. One of those that came to our attention recently is from Community Development, and that's their lead abatement program. This is a program that Community Development has run for years and years and years. And it's one that would be fairly simple to expand utilizing FRF. It's a clearly outlined eligible use within the interim final rule. And we've just outlined a potential here for expanding that program to allow an additional 40 households to be served per year. And we will bring this back at a future date for consideration, but some high-level program parameters there. And if you don't have any questions of me, I will invite Lauren King from Tarrant County Homeless Coalition to address you. Thank you.
Thank you, Kristen. Come on down.
Hello, it's good to see you all. Thanks so much for inviting me, Kristen and Russell, to talk to you all. Let's see here. So today I'm going to talk to you about how we can strengthen the community and really strengthen our response to housing insecurity and homelessness specifically with the investment of ARPA funds. Let's see here. So I want to start by giving you some context. So to give you some context, homelessness is down in our community, which is a great thing. I've been talking to a number of people here locally and communities across the U.S. about kind of why are we experiencing something that most others aren't. I don't know that I have a great answer for you, but our numbers have continued to be down. So to give you an idea, the point in time count was down by 43%. And honestly, we kind of thought that may have been a fluke because we did it differently and was it real? But our monthly numbers in comparison to the pre-pandemic have been down 30 to 40%. The number of households entering homelessness is also down. So to give you an idea, over the past 4 years, we had a high of about 10 households a day entering homelessness. Right now, we're at 4. So last month, we have an average of 4 households entering homelessness a day. Our low has been 3. So we're still, and we think that's because of a number of reasons. I mean, eviction prevention measures, eviction moratorium. I think, too, municipalities and nonprofits working together to make sure needs are met has been a huge success. So homelessness is down in our community. Our response goal for the entire pandemic has been to slow the spread of COVID amongst our population, which I give full credit to our partners on. They've done a great job at that. And also to be able to continue to provide services. So right now we're in a good place because homelessness is down, but our partners are still housing people at a pretty quick pace. And so we're able to quickly move people out. So moving forward, ARPA can really help us restore system capacity and also scale up housing. So we're really focused on housing. I will say, just because homelessness is down right now, I don't feel like that means we should let up on the gas. So I don't think we should say, oh, homelessness is down, good, we've done our work here. For me, talking about this investment, we're really looking at 25, 26, 27, and how can we really transform how our community addresses homelessness long term. So on transforming our response, so our need for ARPA funding that I'm proposing is actually to do a capital infusion to build or acquire housing specifically set aside for people who have experienced homelessness. So right now, physical units are our biggest need. Right now, we're in a situation that I would say that we've never been in, that because homelessness is down, we actually have almost enough resources to meet the need. And I'll talk a little bit about that. I don't know, being in the field for about 15 years, I don't think we've ever been in this spot. But we have the opportunity with ARPA to potentially scale up housing to actually meet the need. So to give you an idea, right now we have about 500 people or households who are actively searching for housing. So that means they've been matched with a housing program. They have guaranteed housing assistance, and they are just searching for a unit. So that's a huge number. That's a lot more than we typically have. And it's a great thing. But like I said, physical units are our biggest issue. Our system is fully focused on housing, so that's a transition that we've made. And we've been focused on housing in the past, but I will say our partners really have worked to be laser focused on it. And I think we really had a turn at the beginning of the pandemic when we really focused on, okay, how can we get people out of congregate settings as quickly as possible? And we've really held on to that to make sure that we're moving people out quickly. We're removing a lot of internal and external barriers, so we're doing things like changing our assessment, creating common applications for things. So as much kind of bureaucracy and barriers that we can break down, we are. And our partners are willing and ready to take on projects. So one of the things that I do as the executive director of the Homeless Coalition is really understand from our partners where they are and where they want to go, because I need to understand, one, are you going to take a left turn on me? And so I can't, then our system changes. And two, as the Homeless Coalition, how can we help support you and advocate for what, as partners, you need? And so in talking with a lot of them, the general consensus is that we're still going to provide shelter, and we want to focus there and be able to provide that need, but really looking to the future, focusing on housing and understanding that that is the permanent solution.
So I have a question for you.
Sure.
You say that you have 500 families that are currently seeking housing.
Mm-hmm.
Have they been matched with available housing, or is there a need to find more available housing?
Correct. So there's a need to find more available units. So they've been matched with a housing subsidy and program. So we have a program that can pay their rent either permanently or for 2 years, depending on kind of what their needs are, but they are looking for an actual unit to move into.
So it's the unit itself. It's not the revenue necessary to
Correct.
To the rental.
Yeah, yeah. Which is unique for us because typically, historically we would have said, oh, we need more rental subsidies, and right now it's not the case.
So the issue of rental increases on apartments and even single-family residences, and we've heard that those increases, those rental numbers are going up substantially.
Mm-hmm. Absolutely.
That's still not that's not necessarily hindering you from the funding aspect. It's just a matter of locating the residences.
So it could be, because it is a matter of landlords being willing to accept what a rental subsidy can pay, and that varies across the county. So that could be part of it, right? Where landlords can be picky and say, no, we don't want to have to take a subsidy. We'll just take all private pay tenants. But as far as our vouchers increasing in value, they definitely do that. Now, are they keeping up with market increases? Depends.
The only reason I ask is because the type of rental assistance that the county is able to, and the municipalities are able to provide by the federal funding streams, that we can pay 100% of the rental, plus utilities, and that can be up to 18 months. So if there's a subsidy and the subsidy doesn't meet the total amount necessary, maybe that's something we can work on to see if we can scale that up so that we can pay those, so that we can get those families into a residential setting.
Make that difference.
So Kristen and I'm working with Kristen and then other municipalities on that as well.
So you're already talking to her?
Huh? I am.
You mentioned also some permanent. About how many individuals do we have that need permanent supportive housing within the county?
So right now we have about 315.
Okay. About 315?
Yes. I think it was 317 was the exact number, but it fluctuates depending on who gets housed. So let's call it about 300.
And how long has it been since we have built any new permanent supportive housing?
Not long at all, actually. So we
Really?
Yeah, so the city of Fort Worth used some CRF funds to build Casa de Esperanza. So they used CRF money to put on an RFP to convert a hotel. That was 119 new units. And then actually just this month, we have, it's a total of 48 units coming online, but it's called Quail Trail. It is close to River Oaks. It's in the city of Fort Worth, but it's close to River Oaks. It's 48 units of permanent supportive housing. And we've actually explored different ways to use existing funding. So for example, with the COC grant, Quail Trail was actually possible. Because of that, we figured out that we could actually do sponsor-based projects, and those belong to that project, and so it helps with making the numbers work, making the financing work. And then you can actually move those to different projects to get projects off the ground. So we've tried to come up with creative ways to do things.
The units that you talked about there, are those owned by Fort Worth Housing?
So Casa de Esperanza is owned by Fort Worth Housing. Quail Trail is owned by New Leaf, which is a partnership between Paulus Foundation, First Presbyterian Church, Fort Worth. I think I'm missing one.
Is it the DRC or no?
So DRC is not part owner. They own the rental assistance part of it. So yeah.
And in each one of those, do you have supportive agencies that are present to help the residents make sure that, who are providing most of those services? Is it MHMR or is it?
Depends. So at Quail Trail, it's DRC Solutions. So they have 2 case managers. It's a total of 48 residents. They have 2 case managers on site. With Esperanza, it is Presbyterian Night Shelter. So I believe they have 3 staff who are there full time. JPS has 2. And then MHMR has at least 1, if not 2. So it's a more comprehensive, I would say.
So are the rest of the units of this 300 and almost about 315, who owns those and where are they?
Well, so that's households who need permanent supportive housing. So is that what you're asking? So that's people who are currently homeless.
Are you telling me then that we're short about 150 or some?
I am. Let me go to the next slide. So I say we actually need about 200 units of permanent supportive housing. And actually, whoops, sorry. I don't know.
You're through.
I know. What happened?
3 minutes. Let us get it.
Okay. So I'll just tell you. So in addition to the 200 units that I'm talking about today, we have other units coming online as well. So, for example, the City of Fort Worth has dedicated their home ARPA money to PSH development. That'll be 150 units. Our community is in, we're in a unique position for a number of reasons, but we actually will, with the amount of housing coming online, we will actually be able to end chronic homelessness. So we will actually have enough housing to house everyone who's been homeless for more than a year. Now, will they all accept the housing? Hopefully. However, that may take, that's a process, and outreach teams are working with them, right? However, we know that we have people in our system who have not been homeless for a year who need permanent assistance. And so our goal as a community is actually to be able to take that year-long requirement off of PSH and actually be able to provide people who need permanent assistance with this housing. Because right now, that's the best fit housing for them, but they kind of bounce around, maybe go into a type of housing program, and ultimately, somehow they end up homeless for a year, but if we don't have to make them wait that long, that's ideal. So that's
I've got to say, that's remarkable news.
It is incredible. Like I said, sometimes like, wow, we're here. So, and I've talked with a number of people just about it. A few years ago, I think it felt so far away, like, will we ever get there? Will we ever get there? But I think really being able to capitalize on our resources I think we've done some pretty incredible things. So, and I think the fact that I feel like 2 worlds are colliding, I guess. Homelessness is down, and also we have a lot of resources. So how do we really capitalize that and really change how we're able to serve people who experience homelessness?
Well, I would add that I think probably as recently as 2 years ago, to say that we could end chronic homelessness, it seemed very aspirational and naive. And even though we know that we won't always, it's a moving target, right?
Mm-hmm.
But it's something that we're a lot closer than we've ever been. I would add that even if we're talking specifically about permanent supportive housing, and I see you'll talk more about deeply affordable units. I mean, we are still, even if enough people aren't calling it, we are in a housing crisis. Mm-hmm. And the fact that we need to have affordability at every level so that no family or person is having to spend, I don't know if this number has changed, more than 30%.
Correct,
of their income on housing, so.
Right.
Bless you.
So that's so with this investment specifically, it would be permanent supportive housing, but we would be able to end the chronic rule. And so it would be for people who just need that permanent subsidy. I will say one thing about our system. So as a whole, one of our jobs as the Homeless Coalition is really to map out resources. We talk a lot about highest and best use and really making sure that as a whole, as the county, we are using federal and private resources, whatever the best way possible, right? So if we have a really strict source that can only pay for one thing, let's make it pay for that, and let's make the flexible thing pay for other gaps in the system. And so as we're mapping funding, we have our annual allocation of about $40 million that comes into our system. It does not come to the Homeless Coalition directly. I have to answer that question quite a bit. It doesn't come to us directly, but we have $40 million that comes in specifically for homeless on an annual basis, outside of CARES, outside of ARPA. And so one of our thoughts with a capital investment is that we don't need this investment every year. This will essentially right size and kind of eliminate the backlog that we have. And then our system actually has enough investment to continue to meet the need. So like I said, we're in a unique position. I did talk about 300 units of deeply affordable for low wage earners. And so there's a number of different ways to do that, but ideally you would keep that rent, let's just call it around $400. People wonder how I come up with that number. Just if you take a minimum wage worker's wages, they might be around $1,000 a month. If you put 30%, clearly that's $300. But so $300 to $400 would be like kind of the magic number there. If we could keep that there, be able to provide services on site and help them get back on their feet. Let's see here. So as far as the use of funds go, I would advocate that housing has to be set aside for people exiting homelessness. If we set it aside for 0 to 30, our population tends to get lost in there because the 0 to 30 income group is much larger than that. I would advocate for a mix of types of housing, ideally around 40 units. I think sometimes when people think, oh my gosh, we're going to build housing for homeless people, they think, this huge complex, hundreds of units, and we really have found that 40 units is probably an ideal size, and a mix of types, right? So it's kind of that thought that one size does not fit all. So, what works for Arlington, what works for Mansfield, what works for North Richland Hills, they're not going to look the same. And so we've worked hard at the Homeless Coalition to really make those relationships with communities to understand what they're looking for, what would be a benefit to their neighborhood, and also just how we can support them. And so really understanding that. So we would advocate for a mix of type of housing. We've thought for a long time, I think about especially families who experience homelessness. Could we put them in single family home or duplexes, quads? Like what would that look like if it wasn't just an apartment? So I was also asked about recuperative care. I think this is something as a county we've talked about for quite a while, where if people experiencing homelessness are in the hospital, they would actually have a place to discharge to. For us, this is not really housing, so it would potentially be looking at something a little bit different, but we would propose 20 units there for people to recover. So instead of having to go to the shelter after they break a bone or something happens, they would actually go to this essentially recovery center. Typical stay is 21 days, and then ideally from there we'd be able to move them into housing. That doesn't happen perfectly all the time, but that would be ideal.
Thank you for including that.
Yeah, of course. So readiness for projects. So a big question I think is always, can we spend? So will we meet the spending deadlines? Our partners are actually actively looking for real estate opportunities. As I mentioned, they're very interested in owning housing and producing housing. They're trying to set themselves up to move quickly. Many of our partner organizations would think something, you all probably know this, but maybe the general public doesn't, especially our shelters already run housing programs. So most of our shelters run either equal to or more housing than they do shelter at this point. And so they're looking for ways to expand that. They're already experts in that area and can do that. I did share that the Homeless Coalition would be willing to run a local competition. That is very much in our lane. We are not looking to own housing, run housing, any of that. We're looking to just facilitate this for the community. And like I mentioned, we're building relationships with neighborhood, understanding that projects have to be beneficial to numerous stakeholders. We cannot take the attitude of, well, this is the right thing to do, so just plop it here. Like, it's got to be beneficial for the neighborhood, for local businesses, and for people who are going to live there. So if it was allocated in 22, we could definitely meet the spending deadline, like I said, because partners are there. As far as long-term impact goes, I truly believe this could have a transformational impact on our system. I think that in looking, like I said, to 25, 26, 27, it could really change how we respond to homelessness. Even with a one-time investment, the projects will have an annual impact. So we watch what the turnover is in our projects. And so even if, let's say it feels like, okay, you built this structure and so it's a one-time, that structure is still going to turn over. So it's still going to create housing every single year that more people can move into as people move on and move up. We've done some modeling that I can share with you all. I didn't want to get into the details here about how this changes in looking at our population growth as a county. What happens if we continue to have 4 households coming in? What happens if it's 6? What happens if it's 10, worst case scenario? And then data supports this investment. So really looking at, what our projected need is, and then what's our resource availability? So how do we continue to sustain this? Do y'all have other questions for me?
I do have one question.
Sure.
So on one of your slides, when we talk about you don't need to go back to it, but it's the recuperative care on the 20 units for physical home care recovery. So are we talking about a facility to house one person, or is it a facility to move a family in while one of the family members are recuperating?
So typically it would be a single person. With the family, typically you would have the person who has the medical need in recuperative care.
So what type of wraparound services are needed in that particular situation?
So that particular situation would be, you would have medical care be the biggest portion of that, just with them recovering. So, thinking about, if you had a surgery and went home, how would you may have home health care come, that sort of thing. So that health care would be the primary. But then ideally, that person would still have a connection with wherever service provider they came from. So let's say they were staying at Presbyterian Night Shelter. Their case manager from the night shelter would still have connection with them and still continue to serve them, even though they were physically staying somewhere else.
So does the Homeless Coalition, do you coordinate that wraparound care?
We would
Or at least
coordinate.
identify people who could do
Yes.
wraparound?
Yeah. I try hard to stay out of direct services, so yes, we would.
I think that's a
We
good
would
idea.
facilitate that, bring the parties to the table, figure out how to make the project work, help with an RFP if an RFP needed to go out, that sort of thing, to see who wanted to do that.
Thank you.
We've talked about the mental health jail diversion.
Talk about it?
We have talked.
Oh, sorry. I was like, what do you want me to talk about? Okay, ready, yes.
Do you foresee, we've talked about your role, I think you've even done some calling and may have talked with Harris County and said, 85% of these folks may be homeless.
Correct, yes.
What is your sense as to the need if we're talking about cranking that out or cranking it up before the end of the year? What is your need with regards to that?
In regard to housing?
Building extra bedrooms on your house?
Sure. So in regard to housing for that, I think it depends. One thing we're talking about as a system is really trying to figure out, and I think we've talked a little bit about this. So currently there's a program in our community called Safe Haven. It is run by Presbyterian Night Shelter for severely mentally ill persons. And we've talked about the fact that we need more safe havens.
Wait a minute, I'm going to have to back up here. Safe Haven?
Yes.
Is that any? But
No connection to Safe Haven in Tarrant County.
Why don't we have two organizations named the same thing?
No, it's a program.
I
think it's a
think it was
program run by, not its own organization.
Yeah, I think it has actually existed prior to Safe Haven renaming themselves. So I'm not sure. It's a grandfathered program that we've had for a long time. But it's 20 units. It's people can live there permanently, and it's really the idea that we've talked a lot about. What happens as a community, what happens when someone cannot live on their own. So for us, when we have housing assistance for someone who has a severe mental illness, them living on their own is not necessarily the best solution. And so we've really said, okay, what would this look like to create more housing like that? Now, is that the solution for everyone at the diversion center? Not necessarily. I have some thoughts on how, if they go into the diversion center, I definitely think we need to have an assessor there to see what their housing situation is. We have a couple of different programs that they could immediately funnel into that specifically address mental health. And then I think as our system gets better and, matching people with housing, placing people in housing, then obviously people could use COC vouchers or whatever kind of voucher if they're homeless. I think there's a lot of opportunity. You could look at an SRO model.
Distinguish for me the difference between maybe the housing for that and permanent supportive housing.
So it depends on, permanent supportive housing, the only difference between that and another type of housing is that permanent supportive housing has no time limitation. So they could stay on that type of housing for the rest of their life if they needed to. Otherwise, most of our other programs are time limited, so you're talking about 3 months to 2 years.
But you had indicated, I thought I heard you say a few minutes ago that some of these individuals with the mental health issues would be permanent.
Correct. Yes. So one of the things about permanent supportive housing is that you have to have a disability, and that could include a mental health diagnosis. And so, if that was the case, yes, it could very well be that it's a good match.
Supportive permanent housing. Mm-hmm. It might be the same facility.
Correct. Yep. Mm-hmm. Absolutely. And then you'd have the wraparound services that are there on site and that kind of thing.
But it's not generally just one size fits all in a situation like that.
Correct. And I will say it is not one size fits all. And I think I don't know that, people going to the diversion center, can you group them all into one, like this is the best housing? No, I don't think so.
That's what your individual there will determine.
Correct.
As to what type of housing, if that's one of their needs, what type of housing do they need at that particular point in the process?
Right. And right now we're going through a process where we're actually changing our assessment. So I don't know if y'all familiar with this, but we've used what's called the VI-SPDAT for probably 10 years. It's an assessment. It essentially assesses for vulnerability. We're actually moving to a housing assessment to actually assess what type of housing best fits this person's need. And one of the main questions is, can they earn and are they willing to earn at this point? And depending on those questions will really make a difference on what type of housing assistance they need.
Do you foresee the need to have someone at the Mental Health Jail Diversion Center on a permanent basis?
Yes.
Okay, and you've already started conversations with somebody?
So, I've talked with Susan.
That's the somebody I was referring to?
Yes, I talked with Susan about that. She's very aware of that. The other thing that we're doing, it's not the same but related, we are actually putting an housing assessor in the jail. So MHMR is doing that, and so we want to try to stop that revolving door between the shelters and the jail, and so really figuring out how to do that. And so we are piloting that starting next month, actually.
So I guess under that scenario, you'd be anticipating release and then try to have some place for that individual to immediately go as opposed to out the back door.
Correct.
Here's your Uber.
Correct.
Certificate. Mm-hmm. Be gone.
And that would be really the same concept with the recuperative care. If someone is released from the hospital,
right.
That they have somewhere to go so they can get better and then keep it,
Yeah, just have a better connection there. Like I said, stop that revolving door ideally between both, right between the jail or the diversion center. We don't want a revolving door in either case. So.
Are we making an attempt to spread that out among the communities of Tarrant County, or is Fort Worth getting to be the benefactor of many of those facilities?
The jail facility? What do you mean?
The housing facilities.
Oh, as far as the housing that we're proposing?
Yes.
No, I would assume it's spread out geographically across the county.
Yeah. I've been having meetings with a few folks in Arlington, and I don't know that there's so much of a concern in since you asked, in Grand Prairie even. There are some issues in Mansfield. But to your point, it's important that it not be all in Fort Worth, right? Because the need is everywhere.
Right, and I think where people, 85% of the people who are experiencing homelessness in Tarrant County came from Tarrant County. So they all have lived somewhere, and they generally like to go back to their neighborhood. They like to go where they've lived. And so even just, not a scientific survey, but kind of polling people to understand, do you want not an apartment? Do you want location was the biggest thing for everyone, is just wanting to be in their neighborhood where that they know. So, but yes, I would think ideally we would have housing spread out across the county.
It's a little bit more of a challenge because of our lack of transportation.
That's exactly right.
It is, yeah. Okay.
That's right, bro.
Thank you, Lauren.
Thank y'all.
And with that, that concludes our work session. We'll be working with IEM to develop a focus area 4 action plan that we'll be bringing back to you all along with other community stakeholder input. If you have any questions, of course, please reach out to Kristen and I. And thank you again for your time today.
Russell, with all of these presentations, are you accumulating proposals, plans, thoughts? I saw Lauren had a few numbers up there. What are you saying to these folks after they make their presentations?
To come and present to Commissioners Court, we always request that they don't have any numbers in the presentations. It's ideas, working through, developing those ideas and looking at those needs, and then put together a proposal and submit it. We are keeping those and working with IEM to try to align the proposals, the needs assessment, and whatnot as we start moving forward. And that's what you'll be seeing with IEM's initial needs assessment and those kind of the low-hanging fruit, those types of issues that we'll be bringing back to you all in the coming month or so.
Thank you.
Thank you all.
Any questions, any other comments that anybody out here wants to make?
Thank everybody for their time and for being here today.
With that, we're adjourned.
8, 1, 3, 4.